for the day. The session is on the science and technology to secure and sustain smallholder farmer livelihood, nutrition and health security. May I call upon Dr. Mohapatra to take over the stage. Dr. Peter Carberry, Director ICRISAT, to take over the stage, please. My colleague Dr. Rengalakshmi and Dr. Bhavani to take over the stage, please. You all know MS Swaminathan Research Foundation has been working with the small and marginal holders in different terrains of India. The foundation has been working with the tribal communities, coastal communities, and people living in semi-arid regions in the country, specifically working with the small and marginal holders, looking at their livelihood, food and nutrition security status, and also the health security. And there are several challenges over the last 30 years Foundation has addressed. Several models have been taken up to the villages. So this session we will be dealing with those challenges, and also we will gain the new knowledge from the eminent speakers here. So this session will be chaired by Dr. Soumya Swaminathan, the Chief Scientist, United Nations World Health Organization. She will be joining us shortly. And this session will be co-chaired by Dr. Mohapatra, Secretary to the Government of India, Department of Agriculture, Research, Education, DARE, and he will be co-chairing the session. And we will have the keynote address delivered by Dr. Peter Carberry, the DG ICRISAT, and my colleagues Dr. Rengalakshmi, the Director of Ecotechnology is here, and Dr. R.V. Bhavani, the Director of ANH, Agriculture, Nutrition and Health. She will be also joining with Dr. Ranga, sharing our experience. May I request Dr. Mohapatra to initiate this session now. Thank you.
A very good morning to each one of you. Respected Professor Swaminathan, other dignitaries present today, Chair Dr. Soumya, she will be joining shortly, Dr. Peter Carberry, and others on the stage. A very good afternoon. After this session of youth, that too in presence of none other than Professor Swaminathan, we have to struggle to improve the quality of this session. I hope Dr. Peter Carberry is ready with appropriate keynote address. We can't obviously match the excellence, the kind of examples Professor Swaminathan has set in all spheres, starting from human values like humility that he is personifying, and moving on to science and science administration and humanitarian value systems, so on and so forth. As it was mentioned that MSSRF has been, since its beginning, working on addressing issues concerning smallholder farmers in India, and also setting standards and examples for global smallholder farming community to take note of and to replicate elsewhere. We are grateful, sir, for continuing the effort and guiding the global agriculture, and more so India's agriculture, and inspiring every one of us your students and grant students and everyone, and including the youth today. And today the topic of this particular session is Science and Technology to Secure and Sustain Smallholder Farmers' Livelihood and Nutrition and Health Security. Quite broad. As you all know, India in particular has a great challenge. India has done pretty well in the field of agriculture, but still the challenge remains, primarily because of the majority, to the tune of 85% of the farmers being small and marginal. The technology based on solid science has done a wonderful job, as I said, and must continue striving to solve the problems of smallholder farmers in this country. We realized green revolution under the leadership of Professor Swaminathan, and we still continue citing this as an example of using science to solve problems of hunger and to a certain extent malnutrition related to hunger, calorie deprivation in this country. And recent history, very recent history, technology also has been a solution provider with regard to sugar revolution that we have. We require 25 million tons and producing more than 30 million tons. And primarily because of a variety, CO238, giving 20 tons more cane yield per hectare than the previous ones which were cultivated in northern India, particularly Uttar Pradesh. And the sugar recovery going beyond 10%, up to 12% reported by different mills. And that adding to our sugar basket handsomely, and the process bringing that kind of self-sufficiency and opening up doors for use of sugarcane juice directly for producing bioethanol, a policy decision that was enabled because we are producing enough for generating sugar as much as required for the country. Also, recent history suggests that the technology and the policy, when they come together, they can also bring revolution and solve problems not only of the farmers, of the consumers and requirements of the country is met, but also it reveals how this convergence, beautiful example, green revolution is there before us, and this is another example, the procurement, the minimum support price, the buffer stock, and then the technology being promoted at the field level, the seeds, for instance, adequate seeds being produced and bringing this pulses revolution. And we needed about 5 million tons we were importing, and we produced 6 to 9 million tons extra year after year for the past 3 years. And this is another example of enabling country to be very close to self-sufficiency. We are still importing because of our commitments and because of certain degree of shortfall in case of P&P, where we have to still do more. So science and technology led developments for not just meeting out the requirements of the country with regard to hunger and malnutrition, but also addressing the problems of farmers. When I say so with certain degree of evidence. For instance, in case of sugarcane, what is added to the gross return in the form of this variety annually is to the tune of 7,000 crores. And similar examples are plenty. And I was discussing with Dr. Krishna Kumar of Biodiversity International, and he did mention that how papaya mealybug was eliminated by using the biocontrol technology and saving in the process to the tune of 2,000 crores annually. I mean, the total saving. So these examples are abound. There are plenty of those. But coming to very specifically using science and technology for smallholder farmers, enhancing the livelihoods, ensuring livelihoods, and also ensuring nutrition, and in the process health security. Dr. Soumya would certainly add to this that the various dimensions, and then certainly this is a very, very important issue before us. MS Swaminathan Foundation is working on farming system for nutrition. We have been working on this area for quite a long time, since Professor's leadership days, and we have almost 51 farming system models. And each one of these models have been designed for different agroecological situations, and particularly targeting small and marginal farmers. And as it is designed, by very nature of it addresses nutrition, because there will be combinations of various crops, commodities, and also goes beyond crops and includes animal husbandry depending on the ecology and regions. And also in certain cases where water is plenty, fishery becomes an important component of these models. In a way, it is holistic in nature, and it is more close to natural farming systems, and also more importantly meeting the nutritional requirement of the farmers to start with, and also when extended of the consumers. So farming system for nutrition is in fact addressing the same nutrition component very emphatically, very specifically, which has been designed, already we were discussing yesterday, and hopefully we'll be able to extend it, scale it up to the whole country, so that the farmers as consumers, first of all, the other day, Professor Swaminathan advised me, when we talk of consumers, first of all, farmers themselves are consumers, a huge number. So their families, huge number, is a huge percentage of population. So you have to address the malnutrition issues there, first of all. So probably this is one issue which is very, very crucial. At the same time, when we talk of smallholder farming, so Honorable Prime Minister has given a clarion call that by 2022 we have to enhance the income. When we talk of livelihood security in the context of changing climate, and obviously this is a big challenge. And I, as a co-chair, welcome Dr. Soumya, and so I don't have to extend any further. I'll stop here, but with a few words that I once again welcome all of you to this session. And I was talking about enhancing income. Certainly, how do we enhance double the income of the farmers, particularly smallholder farmers, ensure livelihood in the context of climate change and the variables in terms of weather parameters, as we see, is tremendous. Yesterday, and we keep on reading in the newspapers, and how Europe is suffering. And so also many other parts of the country, and in India, the kind of variation that we see in rainfall patterns. So it's a tremendous challenge to sustain this. And I'm sure this session would address some of these concerns and issues which are there in the context of climate change and the smallholder nature of farming. But the fact is, someone questioned me, why India should have so many smallholder farmers? Can we have some policies to address this issue and root out these fundamentally? And can we bring some changes so that the small farmers and big farm concepts by way of cooperative farming and so on and so forth, and leasing, whatever way it is, and can we really address these small smallholder farmer issue in a different way and bring technology which are suitable for big farms. And that's a different sphere altogether. I do not know how much we'll be discussing. I have taken more time than what is required, and we started a bit late. And but never mind, we should be able to do this in time. And thank you very much. And I hope this session would be providing deeper insight into issues and bringing out recommendations for taking them forward by those who matter. And wishing a very fruitful discussion. Thank you very much, and thanks for giving me this opportunity.
Thank you, Dr. Mohapatra Ji, for that initial remarks. Now I request Dr. Soumya Swaminathan, the Chief Scientist, World Health Organization, to make initial remarks and chair the session.
Good morning, colleagues, and apologies for joining the session late. I was actually addressing some medical students in Hyderabad who were very keen to hear me, and they wanted me to be there, but I said I would do it on Skype. And so there were delays in that, so apologies. I think Dr. Mohapatra has already set the scene for this morning's session. I just want to add a few words on the linkage between health, and then we'll turn over to our colleagues from the foundation to make the presentation. So as you know, we have less than 11 years now for the Sustainable Development, achieving the SDGs, which includes, of course, ending hunger, but also SDG 3, which is health and well-being for all. We're far away from that. We have today 400 million people who do not have basic access to any kind of health services, and about half the world's population that does not have access to the full range of quality health services. But one important element that's often forgotten about health, when we talk about health, we think about healthcare and services through the healthcare system, through hospitals, through health centers, but we forget about the determinants of health. What is it that keeps us healthy and well? When we fall sick, we think about healthcare, but we do not think about how to keep ourselves well. And that really are the determinants, like the most important ones, at least for India, that has been studied through the global burden of disease. When I was in ICMR, we had undertaken the study of disease burden and risk factors across India for every state. And it was the first time that was done. And it showed not only the burden of disease being mainly non-communicable diseases now, because during the MDG era, we focused on maternal and child health and infectious diseases like TB, HIV, and malaria. Not that those are gone away. We still have those problems. But the overwhelming majority of Indians today, the disability and death is due to non-communicable diseases. It's hypertension, diabetes, cardiovascular disease, cancer, and stroke. And the 5 risk factors for those are basically around unhealthy diets, either undernutrition or overnutrition. Then hypertension and diabetes are important risk factors for any of these diseases. The quality of air we breathe, we know that nowhere in India do we have good quality of air, but particularly along the northern Gangetic plains, and particularly during the winter months, the air quality, the PM 2.5 is often 10 times higher than the WHO recommended limits. And then water and sanitation, which of course now being addressed through the Swachh Bharat program, but still we are not completely, at least the sanitation part now the coverage is improved, but water, and even in health facilities, water and sanitation is an issue. So these are actions that need to be taken in other sectors. One important risk factor is tobacco. I think India has done well in terms of reducing the number of people who are smoking, a percentage of people anyway, but we have a huge problem of smokeless tobacco. More than half the tobacco users in the country use smokeless tobacco. The other half use cigarettes and or BDs. So smokeless tobacco has been a challenge, and also the control of BD. Alcohol is also a big risk factor for health. But what is relevant for today, I think, is nutrition, particularly the nutrition of farmers and rural populations. But again, we can't forget the urban. The urban poor in fact, are the ones in which the rates of diabetes are increasing at the most rapid rate. One often thinks of high blood pressure and high blood sugar as diseases of the well-off. It's not true. Hypertension is the most common problem in tribal areas, and so is undernutrition. And in the urban poor, diabetes is becoming a very major problem for them. So it is not enough for doctors to just advise patients, go exercise, have a healthy diet, without thinking about how are they going to do that? How will they afford a healthy diet? And where are they going to go and exercise? Do we have open spaces? Yesterday I requested the Chief Minister to have a big movement for physical activity in Tamil Nadu. Other countries have done that. The Prime Minister of Thailand has banned cars 1 day a week. Everybody and all government offices, people have to go out and exercise for 2 hours in the afternoon on every Wednesday. In Rwanda, they have, in many countries in Africa, they have a car-free day. People have to walk or cycle. I think it's high time that we did that in our cities to encourage people to exercise more. Even if you want to now, it's difficult. And also then the affordable diets. If people who are basically buying rice from the PDS and who don't have a lot of flexible income to buy fruits, vegetables, or even millets or pulses, can we provide those in a more affordable manner? And of course, we will hear now the foundation's work in this area, particularly working with farmers and the farming systems for nutrition, and what are the lessons that we have learned. So I'd like to now invite Dr. Bhavani and Dr. Rengalakshmi to make the presentation. Dr. Rengalakshmi is the director of the JRD Tata Ecotechnology Center and has over 20 years of experience as a development researcher and a field level practitioner in the area of sustainable development. And Dr. Bhavani leads the Agriculture, Nutrition and Health program of the foundation. And she has been a project manager for LANSA, which is a project on leveraging agriculture for nutrition in South Asia. So hand over to both of you now for your presentation.
My presentation is focusing on sustainable livelihoods. So as mentioned by co-chair that Indian agriculture, that 58% of people basically depend on agriculture as a primary livelihood, of which 85% are small and marginal farmers holding less than 2 hectares of the land. But it is a 45% of the total area of the cultivable land. When we take the structure of the household income among smallholders, around 47% comes from the crop cultivation, followed by wages and salaries. So it means the livelihood strategies are a kind of a combined one with agriculture, crop cultivation, animal husbandry and wage laborer. When we see the farming system into account, here the use of natural resources, it plays a major role in deciding the productivity of that particular ecosystem. And here the groundwater usage, when we take into account, the water levels in most of the blocks, it has gone down to a kind of an critical or overexploited level. And when we analyze the number of bore wells among smallholders, which is 66% of the wells owned by smallholders when compared to the overall system. With reference to the soil degradation, to the balanced use of organic and inorganic, there is a kind of a challenge here. And the gender equity in land ownership and access to productive resources. Again, the most important point is the share of institutional credit to smallholders. That is a kind of an initiatives taken by government to bring the credit access, but still there is a wide gap in it. And increasing the degree of climate variability and change, again adding to the whole problem of the above issues. Nevertheless, the market access and risk also play a kind of an higher risk in farming that makes farming a kind of an unviable in many contexts. And this presentation is basically following the framework of sustainable livelihoods. And we first understand the vulnerability context, what is the seasonality trend changes, the risk factors associated with that, then what is the capital assets which are available and the 5 capital assets of the livelihoods, what is their influence, Then the policy and institution processes which is supporting the assets to have a kind of a good livelihood strategies, that comes to the outcomes. And in that, when we talk about the livelihoods, the three major aspects, capabilities, assets and activities, play a major role in deciding the income as well as the overall securing the livelihood of the smallholders. And when we discuss these aspects into a kind of a sustainability aspect, again we need to link with the natural resource base, how the livelihood is taken up. In the foundation, we adopt a kind of four different models to promote livelihoods. One is started with the biovillage, then moved to bio-industrial watershed, then sustainable agriculture, that is the intensification and diversification as a strategy, then eco-enterprises with the landless. Here, for want of time, I am taking just two examples. One is with the landed farmers, that is the bio-industrial watershed, then second one is the eco-enterprise with agriculture laborers. And in all cases, almost the framework is linking the productivity with natural resource conservation, but still challenge as we have been facing when implementing it in the field. This is the broader framework of the bio-industrial watershed, and in which conservation of natural resources, then improving the livelihood of small and marginal farmers, especially on-farm and as off-farm, how we can promote by combining these two resources, and how the enhancement in the livelihood can be sustained over a period of time by building a kind of a value chain in that situation. And this is the process. The initial years we are focusing on creating a kind of an access to water and other livelihood capital, then moving into a kind of an institutionalization process, then sustaining the process, moving to the next level of value chain, and the scaling up. The whole process almost take around 10 to 12 years to reach. And here the key drivers we are focusing, we focus during our intervention. One is access to water, credit and other support services, bridging the yield gap and increase the productivity, bringing the value addition technologies to the smallholders. Then the risk management, especially the abiotic factors, how we can facilitate the institution building and market access. And this is a case of one example. This is a Tola watershed in Koraput. It took around 8 years for us to implement in that location. The total area, it's a micro watershed, 750 hectares, covering around 272 families. The enhancement of natural resources, a set of watershed initiatives have gone in, and for addressing the productivity issues, the major cropping in that location is paddy, groundnut and pulses. So in that, how we can increase or enhance the productivity using sustainable agriculture practices are gone in. And when we come to the major outcomes in building the livelihood assets over a period of time, that the physical asset, natural capital, human capital, financial capital, as well as the social capital. But how do we sustain these over a period of time? That depends upon how the institution is taking forward the initiative, the local collective, farmer collective is taking the initiative to the next level. And the second case is on eco-enterprises. This is with agriculture labor communities. When we see the context, here 52% of them are agriculture laborers. The field site is Rediyarchatram in Dindikal district. And among 52% of the labor community, 60% are women. So belong to socially disadvantaged community. And the area of cultivation in the whole total block is around 20,000 hectares. The literacy rate also, again, the gender differences are there. But when we come to the vulnerability context among agriculture laborers, the employment opportunities are very skewed, and saving assets and other wage rate, there are differences in that local context. And the added thing is, when agricultural labor opportunities are not available, then what is the scope for entrepreneurship? That is also a kind of a challenging situation in the context. But when we promote entrepreneurship activities among these kind of vulnerable or marginalized communities, what is the scope for bringing the science and technology to improve or provide opportunities for them? And in that initiative, we have introduced a kind of a decentralized production of biological inputs, because considering that particular semi-arid agro-ecosystem with multiple crops cultivated throughout season, at almost 2 seasons they have cultivated 2 full crop, and in summer wherever the irrigation facility is available they go for vegetable cultivation. So considering that local context, we promoted different kind of biological inputs which can be taken up by agriculture laborers as a kind of an enterprise, where the technological support was provided by foundation to fine tune the technology to the local context. And we have introduced around 15 technologies of different biofertilizer, biopesticides, including insecticides, bioinsecticides. But still there are challenges in fine tuning the technologies and meeting a kind of an meeting the requirement of the farmer at the right time, because the shelf life associated with the biopesticide is a kind of an issue when we promote such enterprises in the rural context. So we facilitated the capacity building process in association with Tamil Nadu Agriculture University and fine-tuned the technology to the local context. And in the process, we facilitated the business development services by making a kind of an institutionalization framework. The members have been organized into a federation, and the federation provided a kind of an support for making a livelihood over a period of time, because initial challenges on the production we supported, but over a period of time marketing, upgrading the technology or expanding the network, in those cases the federation came forward to extend the necessary linkages. And in that very crucial aspects, technology upgradation and product diversification, because as the technologies are new technologies getting developed, the older technologies are not kind of an use in the field. Example, in the case of biofertilizer, earlier a kind of an solid form using the talc powder is a very common, but now they shifted to liquid culture. So it needs a kind of an technology upgradation at the local level. But as a kind of an rural entrepreneurs, they find it difficult to again get into the process. In such cases, they need facilitation or support from our end. When we see the outcome here, access to technology, that it's a kind of an skilled employment they are moving into, and it's a non-traditional job and it's a skill and knowledge intensive one. And assets in the name of women, that over a period of time it's getting created, and it is a collective asset as a group, they are owning it. And the entrepreneurial capacities, and the initial stage there was a huge indifference even among women as well as their family. That took some time for us to overcome these kind of challenges at the field level. And expansion and the institutional linkages, though the project period is for 3 years kind of thing, but the continuous support is needed to build these institutional linkages. When we analyze the gains and losses of these women due to this entrepreneurial initiative, the two main issues, that is the work burden as well as the leisure time. How do we address that? In this, it is less equitable for women, and though other components like skill, knowledge, responsibilities, participation, decision making, control over assets, there is a positive impact on it. And addressing these issues, still we have been interacting with them. It needs a wider context of support. Not only from the family, from the society, there should be a kind of some changes needed. And another opportunity we now look forward is a kind of adopting a model of rice biopark, wherein every part of the plant is being value added and the farmer income is going up. For example, here in rice, the 1:1 portion, 1% grain and remaining percent biomass. These biomasses Right now, it is a kind of an underutilized one. But how do we take it up? Right now, we have established a facility in Myanmar. Still, we need to operationalize the initiative. Then only we will come to know what is the positive as well as the negative of it. But still, we are thinking of how do we promote such kind of an effort in pulses, considering the biomass which we are generating in the pulses plant in different pulses species. So as I said, the mobilization and organization, when we promote or when we work with small and marginal farmers, then the capacity building process, it takes a very long time and need a different kind of approach. Mere training may not help them to get into the next level, and the business development services should be associated while we promote entrepreneurship among rural communities. The access to technology, again here many of the technologies which have been developed by several agriculture universities as well as research institute, how do we operationalize in the field? In that, some kind of a mediator support is necessary to take the technology to the field. And the challenges, as I mentioned during the presentation, one is the striking the balance among ecological and economic sustainability dimension. That one, I mean, to an extent we could able to practice it in the field. But when we bring in the social element, how do we take it forward? That is one. Yesterday also we had a discussion in the coastal zone management, how the sustainability component in the framework of sustainable development we can take it forward. Then sustaining the collective power to address the inequalities, because it needs a kind of a continuous nurturing. Who will do? How do we take it forward? Then the goals of economic and social empowerment, that may not always go together based on our experience, but how do we bring new strategies to address these issues? And the key learnings when we work with small farmers, when we provide access to productive resources, there is a possibility to bring agency and power, especially in decision making, self-confidence as well as the capabilities. But sustaining these issues over a period of time, we need to have a good strategies. Thank you.
So you heard my colleague Rengalakshmi talk about the livelihood aspect, and my focus will be on leveraging agriculture for nutrition. Again, the context being that we have this large population of small and marginal farmers, and also this huge problem of the population being undernourished. We are running late, and so I'm going to be rushing through some of the slides, but the essence is there, and I'll aim to convey the essence, and we can always discuss. Please let me know if you have any questions subsequently. So this is basically the context in which we are proposing leveraging agriculture for nutrition. And at the foundation, focus on food and nutrition security has been an underlying theme right from the start. We have led an hunger-free area program and various, worked in various dimensions. So just to set the context again in terms of what are the pathways that link agriculture and nutrition. So there are the direct pathways in terms of access to food, the availability, the income aspect, and then the gender pathways around women's empowerment, women's decision-making power, and the time for care work. And underlying all of this, the point that Dr. Soumya mentioned about WASH, the importance of WASH and an enabling environment prevailing for this. So as I said, we have been working on food and nutrition security at the research level in collaboration with World Food Programme. We've been engaged in producing reports on the state of food insecurity in rural India, urban India, the sustainability of food insecurity, in policy analysis, looking at the functioning of different food distribution programs, and also piloting models of community food grain banks to address transient hunger, working with women farmers in Vidarbha and in Orissa to empower them in sustainable agriculture practices and promote household level food security. And most recently, over the last 6 years, we were the lead of this research program consortium on leveraging agriculture for nutrition in South Asia, under which there were a portfolio of studies at the policy level, looking at the public distribution system, at the agri-food value chain and how to make them nutrition sensitive. There are outputs from all of these that are available. But my focus today will be on nutrition sensitive agriculture and the farming system for nutrition study. And there is also this aspect of women in agriculture and nutrition, which Dr. Nitya Rao, who also was associated with LANSA, she would be throwing some light on that during her presentation later on. And again, in terms of the evidence that we find globally about nutrition-sensitive agriculture and how effective it is for linking agriculture to nutrition, a systematic review last year led by Mary Ruel came out with arrived at the conclusion that agriculture should focus on improving dietary diversity and high-quality diets as a precursor to better nutrition outcomes. And this is essentially the focus of the farming system for nutrition approach that we at the Swaminathan Research Foundation have been advocating for. Dr. Mohapatra in his introductory remarks spoke about the farming system model and the different models available across the country. But sir, we feel the nutrition dimension has to be explicitly incorporated in this, because the focus tends to be on production, productivity, sustainability, income generation, but somewhere it may be happening, but unless, given the undernourished population that we have, unless this nutrition focus is explicitly highlighted, we feel that it kind of loses the importance needed. And it has to be a location-specific model to address the specific nutritional deficiency prevailing in that area. And a small and marginal farmer may not have all the resources required for an integrated farming system model. So based on the available resources that he or she has, the farming system for that household level food security will have to be designed. And in this, nutrition awareness has a very important role to play. So building the capacity of rural men and women on understanding the source of food, what nutrients you get from it, and the need for a balanced diet. So that's the approach with which we are moving forward on this. And we worked on demonstrating this in 2 locations, in Orissa in Koraput and in Vardha in Vidarbha. And the main starting point was that it was an undernourished population and diets largely cereal dominated and agriculture dependent population. So our focus under this became on, our thrust under the FSN approach was on addressing this disconnect. Like, you are dependent on agriculture, how do you get more nutritious food from your own agriculture? So essentially then focusing on increasing the production and productivity of nutrient-dense crops like millets and pulses. For in Vidarbha, for instance, the sorghum which they used to cultivate and consume, the land had largely been replaced by BT cotton. So bringing back sorghum, at least for your household consumption, and then improved variety of finger millet. Pulse, Dr. Mohapatra also mentioned the pulses revolution, but again, one is to bring in more pulse diversification, as well as what we found at the grassroots level was the improved varieties of pulses seeds was not really reaching the farmers there. So making that available, as well as improved cultivation practices. So this bridging this lacuna in the extension system. So this was the framework in which the model kind of evolved, the crop interventions, focusing on enhancing productivity through varietal substitution and crop diversification, and nutrition gardens of fruits and vegetables. So not calling it kitchen garden or home garden, but nutrition garden to emphasize the nutrition aspect and trying to ensure that it includes all the 3 groups of vegetables and fruits. And nutrition awareness as an underlying theme across the board. So this is how it panned out. So where post-harvest of paddy, the land used to be left fallow. There was pulse cultivation was promoted, improved variety of finger millet seeds, intercropping of maize and PG&P to increase the availability, again the nutrition garden of fruits and vegetables. And similarly in Wardha, where again pulse diversification was a focus, increasing area under bringing back sorghum cultivation and micronutrient dense varieties of wheat and improved variety of Bengal gram. So to quickly take you through what we, and of course nutrition awareness like I mentioned, these were at multiple levels, household level, community level, starting school nutrition gardens as well to bring in awareness among school children, and also selecting men and women from the community and training them on these aspects to be the spokespersons. The community, what Professor Swaminathan has termed the community hunger fighters, and making them take forward the initiative. So to quickly run you through, this is how we went about, and late 2017, we did an endline survey to see where we were. So one was the increased participation of farmers working with, initially it was through demonstrations, we were giving the entire support from the project, but by the end of it, it was only technical knowledge and there was greater uptake. In terms of food consumption, increased frequency of consumption of different food groups, increased average intake, diversified pulse production as well as consumption, increased intake of vegetables, which was observed both in Koraput and in Wardha. So in terms of the improved variety and package of practice of production diversity leading to helping in leading to consumption diversity through these points that I highlighted, and overall in terms of the nutrition awareness, a greater understanding of nutrition sensitive agriculture, how to source it from your own production and practicing of the same. And towards the end of it, we found the innovations emerging from the rural community itself. They're coming up with ideas, okay, you have to grow vegetables, you don't have backyard land, grow it in the field bunds and make sure that you have it for consumption. And there were other than neighboring villages, there was uptake of the intervention, there was demand for it. Processing, the need for millet processing, pulse processing, so that demand emerged. So setting up decentralized village level processing units managed by women's groups or farmers clubs, that has been a development which took up. And most importantly, farm men and women emerging as spokespersons in this whole process to take forward the initiative. And in parallel, along with this process, we have been engaged in advocacy of the farming system for nutrition approach with the government and with policymakers at the state level as well as the national level. Early last year, we had this meeting on leveraging agriculture for nutrition with Niti Aayog that was chaired by the member agriculture and member nutrition, which I think was a big message being sent out. And one of the recommendations there, the minutes are there in your folders, sir, was that ICAR promote this farming system for nutrition approach through Krishi Vigyan Kendras. And with support from the Tata Trust, we've been engaged in actively advocating this in 4 states. And we looked at the existing agriculture policies in these states, how to make them more nutrition sensitive. Recommendations for these have also been made. And with the KVKs, in Andhra and Orissa and in Maharashtra, we are going forward with this model of promoting it through Krishi Vigyan Kendras. We're looking at, Dr. Mohapatra, a 1-acre model of the farming system for nutrition model and 2 cents of land for nutrition garden, and accompanied by nutrition awareness. So we've had workshop with identified Krishi Vigyan Kendras from these states. In Maharashtra, UNICEF has come forward to support uptake of this through the agriculture universities in Maharashtra. And so that is where we look forward to greater support to taking this forward and greater uptake and working with other partners in taking this forward. Thank you.
Okay, thank you very much, Ranga and Dr. Rengalakshmi and Dr. Bhavani. I think we'll have time later on for discussion, but perhaps we move on now to the keynote address by Dr. Peter Carberry. Peter is the Director General of ICRISAT since October 2018. He's also served as Deputy Director General of ICRISAT and also did your PhD in ICRISAT, as you were sharing yesterday. So he's going to give the keynote address on success in feeding the world or source of social and environmental concern. Dr. Carberry, please.
And Professor Swaminathan, thanks for the pressure Dr. Mohapatra. Soumya Swaminathan, the co-chair, thanks for the introduction. Bhavani and the Foundation, thanks for the invitation to join us here. Yes, before I started my presentation, I think many of us have shared our own personal stories about meeting Professor Swaminathan, and my story goes back to 2004 at the International Crop Science Congress. Professor Swaminathan, you were the keynote address in a session that was titled Crop Scientists as Change Agents. Could we as scientists help change the world? And Professor was the keynote address. And I followed you. I was on the stage with you there and met you on the stage, and I had to follow your talk. And what was extra pressure for me is that was the only time in my career that my parents who are farmers, cotton, wheat farmers in Australia, they came to that session and listened to you and myself. And afterwards, my father said to me, he said, "Peter, I'm so glad you didn't come back to the farm. You would have been a hopeless farmer. But you're an okay researcher," and it was very inspiring to join that session. So thank you, Professor, for inspiring my parents and to helping me on a path, inspiring me early in my career, mid-career, to crop scientists as change agents. This session is around science and technology, and we've heard the introductions from Dr. Mohapatra, Bhavani, and the Foundation. And I was asked to give a title here, and the title that I wanted to give in terms of this interpretation is what is the agricultural narrative? Is the narrative around agriculture around what we've achieved in terms of feeding the world, or is it that narrative that you hear much of today around agriculture being a source of the problems of the world? And I think we in the room here can choose that narrative and how we talk about agriculture. And it was a wonderful first session, Professor Swaminathan, when you addressed questions of the students. And many of the questions touched on this narrative. They were asking about this duality of where agriculture sits. And I particularly liked your response to the zero budget natural farming question. I'm going to use you as one of my sources when I'm asked about that as well. So a great first session. But let's talk about this agriculture's narrative. I want to start off, it's very appropriate as a DG of ICRISAT that I come to the 30th anniversary of the Swaminathan Foundation. Dr. Swaminathan was the Vice Chair of the Technical Advisory Committee that established the Consultative Group for International Agricultural Research, the CGIAR. He established ICRISAT. The decision to create a Millet and Sorghum Institute and a Legume Institute, it was through the influence of Dr. Swaminathan to say, let's make that one institute. The legumes and the cereals go together in the farming system. And ICRISAT was formed in 1972 in Patncheru in Andhra Pradesh as a state then. And you can see here younger Dr. Swaminathan with the Prime Minister of India at the establishment of ICRISAT 47 years ago. I want to then flip to this a conference that's on next week. So the chair of that technical advisory group for the CGIAR was John Crawford, Sir John Crawford, and a good friend of Professor Swaminathan, I'm sure. So every year there is a Crawford conference. So I'm here at the Foundation's conference, annual conference, and on Monday and Tuesday next week I'm speaking at the Crawford conference. And I want to be able to refer back to this meeting today and the duality and the influence of Sir John Crawford and Professor Swaminathan on what's happening not just in India or South Asia, what's happening in Australia and the world. The topic of that conference in Australia is weathering the perfect storm. And that's aligning again with the agenda we're talking about. And my particular request to speak at that conference is around talking to the youth, about mentoring them, about how they can contribute into global agriculture's challenges. And I will be referring to this session and what I've learnt today when I talk to those young Australians next week. This perfect storm, we see it so often when we read our publications, we read the press, we go to presentations like this, and so often people start their narrative around the problems of the world as we look forward, and I don't have to articulate them. You've seen them many times in presentations. I've got a slide up here from the CGIAR talking about greenhouse gas arising and the loss of forestry around the world. You can see papers like this that where people have forecast the future. Very difficult to predict the future, but people are publishing. And this says basically that that common bean will not be a crop for East Africa, a very important legume in East Africa, by 2050. In actual fact, this paper said that 40% of the land that grows maize today in Eastern Africa will not sustain maize in 30 years' time. These are serious concerns for the world, and it's a narrative that you hear. Publication by Leslie Lipper from FAO about promoting climate-smart agriculture for food security. Climate-smart agriculture is a wonderful initiative, and I'll come to that. But look at the narrative that you see in introducing this. It's not around leveraging innovation, around the innovation of science and on building on the track record of being able to achieve through what we've achieved through the Green Revolution. It's around the need for step changes, the need transformational change. Otherwise, we're in a lose-lose situation. So often we see this in our narrative. And when I look at climate-smart agriculture, I think it's a great banner. It's a great way to sell what we can do looking forward. It's not just around agricultural productivity and resilience. It's also around what we can do to address climate change through the mitigation possibilities. These three agendas looking forward. And I think that's something that way we should frame agriculture. But we also, and this is a key aspect of my talk, even if you do the best climate-smart agriculture, dryland agriculture, particularly where ICRISAT works in the drylands, is risky. So here's some results from field work done in Kenya of looking at different conservation tillage, mulch, fertiliser regimes. You can still see some years you can do the best you can and still fail. Dryland agriculture is risky. Agriculture is risky. So, what's the other narrative? It's a narrative about what we've done in the world. There's Bill Gates puts a blog out, and this is a blog that he released just in the last month, where he says that he asks people what's for dinner and the impact of the CGIAR, but really the global innovation system around agriculture contributing to answer that question. I'll skip through these quickly. This CGIAR is the largest global agricultural research network. We work very closely with the national systems in countries around the world. It's scattered across the world, as you can see here. ICRISAT, it's really pleasing to see, Bhavani and others, you're talking about the millets and sorghum and the pulses and how important they are to Indian smallholder farmers. We had a marvellous dinner last night, those that were privileged to be invited to a 7-course feast around millets and sorghum and pulses and other crops. And it was a wonderful view about how these crops can be nutritious, can be tasty, can be high-end dining if you need to. At ICRISAT, we, like the foundation, have recognised that we can't just see millets, sorghums, the pulses as traditional staples that the next generation will not see in the same light as rice and wheat and maize. So we talk about these crops as being smart food, good for you, good for the planet, good for the small farmer. That's the narrative we have to have about these traditional, nutritious, important crops going forward. They're not what my parents ate. They're not people that the subsistence farmers eat. They're food that's contemporary, nutritious, and can fulfill a full lifestyle if we consume it. They're smart food. Okay, but what can we do if you run into this situation? Drought. What can be done under dryland agriculture? This is some results of fertiliser response curves and population curves on different seasons in Kenya. And you can see that you're not getting the same response every year, so it's risky. This is probably one of the most key slides I have in my pack. This is the results from a real farm in Australia. 15,000 hectares, yeah, 5,000 hectares farm in Victoria. This farmer, John Ferrier, and his son David and wife Robin, they have access to the best technology in the world. They have access to seasonal climate forecasts, they have access to private extension services, they have best seeds, and this is their profit over a period. And you can see, even with access to the best innovations, the best technologies, they're losing lots of money in a number of years. This is the reality of dryland farming, and this is the challenge that we as technologists and scientists have to address if we're going forward. How can we address farmers, particularly small farmers? The way that the farriers deal with this in Australia is that they have a bank that underwrites them, and their equity will go down as they lose $1 million. Their equity in their farm will go down, and then they make $1 million and it'll go up. But if you're a small farmer in India or Africa, what can you do? What can we do to address these issues? Managing for climate variability and change is critical. It's a narrative that we hear coming forward all the time. And I'm suggesting that there's these ways that you can do it. I'm going to quickly run through it so I can get to my final slides. The watershed story, the development that we've just seen that the Foundation's supporting in India is amazing. To be able to capture the water in the landscape and to be able to use that landscape for supplementary irrigation is no doubt it's a winning technology that's had big impacts in India. Diversification, the fact that livestock are incredibly important in the croplands. Here is some data from India that shows that 70% of the feed resource for livestock in India comes from crop residues. This integration of cropping and livestock has to be better addressed by institutions such as ICRISAT. We have to understand that livestock are an important livelihood component of smallholder farming. Breeding, when you come from a crop improvement institute, you can't not talk about the role of technology through crop breeding and better varieties and hybrids. ICRISAT and our partnership with ICAR and other national institutes spends a lot of effort in terms of looking at traits for drought, heat tolerance, and with significant impacts. Here's some data. On the top one is the area and yield of chickpea, the pulse revolution that Dr. Mohapatra talked about in India. In the bottom is the impact in Myanmar in terms of its investment in pulses. So this is mainly driven by access to better varieties, but also agronomy. Agronomy is also important. Conservation agriculture, the big strides that India's made and other places around the world, but it takes a long time to get these complex technologies adopted by farmers. These are the adoption curves in Australia for conservation agriculture, a technology that took 20 and 30 years for farmers to be able to adopt. Seasonal climate forecasting, to be able to predict what the rain's going to be, whether it's 3 days ahead, 4 days ahead, or the season ahead. And there is skill being developed. I won't go into it here, but this is basically showing that you can disaggregate that skill into useful information for farmers. Knowing more about your soil is incredibly important. This is some work done to show that basically at the bottom, if you have an early season break and you have a profile that has water in it at the start of the season, then you're almost guaranteed in southern Australia of achieving a good yield. But if you have a late season break, the top graphs, with no starting soil water, then you're guaranteed failure, almost. And so knowing your soil water at the start of the season is incredibly important. Actual fact, I will say here that knowing your soil water is more important than a seasonal forecast. It's what you know, it's in the bank rather than trying to predict what's going to come. And I don't think that's recognised by many in the research and extension services. There's not enough done on knowing people's soils and knowing what the resources are. I've just come back from China this way, and I didn't realise it, but China transformed its agriculture through plastic. They cover their landscape in plastic. Who's been to China and seen the plastic revolution there? Yields of 50 to 60% higher if you put plastic on the ground. But then they have an incredible pollution problem about trying to get rid of that plastic. But that's something that we should be thinking about. Technology that can be an evaporation barrier, maybe a biodegradable polymer, that can stop evaporation with double or triple yields. Decision support systems are a very common topic that people are interested in. You know, this idea that you can provide people with an app. Everyone's got these phones, give them an app and it'll tell them how to do. And I've worked most of my career in this area, and we built a product called Yield Profit in Australia. It's accessible by any farmer in Australia, used by many. And this idea to be able to predict what the outcome might be in the future. And I can give you stories where farmers have benefited to access this technology. Here's an example, the same ferry as I talked about earlier, where in a decile 2 season, they were able to achieve a 6-tonne wheat crop, dry land, by knowing their soil water, by using the climate forecast. Many people want to build apps to be able to give people information, and I think we have to be cautious about how people access information. The social scientists in the room will know that people don't make decisions always by analysis. They use intuition, and how do you build in that intuition? Okay, my final slides. We've got to realise that most of my talk, when I've talked about science and technology, is about how do we deal with this risk dimension, the climate variability, the climate change risk. And we have to realise, as we ask farmers to invest, their risk is going to go up, not down in most circumstances. As you put on more fertiliser, you become riskier. So what we have to do is look for these B to F opportunities. What technologies can increase productivity, change the dimensions of our farming without increasing their risk? And we have to do more in Africa. India and China have done an incredible job. It hasn't been transformed to Africa. Professor Swaminathan, ICRISAT hasn't done its job fully. We've worked with ICAR, Dr. Mohapatra and others in India, and I think achieved much. We have to do much more in Africa. These are the yields in pearl millet and sorghum, basically stagnant in the West Africa and going down in East Africa. We have to do more. And this is something that I've been talking to Dr. Mohapatra about and others about. Through India's South-South collaboration, can we transfer the lessons, the technologies, the learnings, the expertise, the capacity that's in India, and can we support Africa to achieve what it has to achieve, what the countries in Africa have to achieve in the future? So with my conclusions, I'm very much of the view that we should be standing on these podiums talking about agriculture's narrative as one of success, not discounting that the future challenges and current challenges have to be met through science and technology. We have a role for smallholder farmers and consumers around the world to make sure they're profitable, productive, and they have access to nutritious and safe food. And we have to deal with this issue of risk. We can't ignore it, the fact that climate-smart agriculture will still lead to failure in some years. And I ask you in the room here and the foundation to work with ICRISAT and the CGIAR and ICAR and others to look at this opportunity for South-South collaboration between India and Africa. With that, thank you very much.
Thank you very much, Dr. Carberry. That was a very inspiring speech. So maybe we can have about 5 minutes of discussion, comments or questions before we break for tea. Yes, please. You can introduce yourself. Do we have a mic in the audience? Dr. Iyer, please keep your comments or questions very brief. Thank you.
Thank you, Dr. Soumya. My comment is regarding the nutrition garden approach, which Bhavani mentioned. I'm glad this should have come in the previous session, interaction with students. We had some experience which I want to share with you. Dr. Rohini, my wife, and myself were running a small NGO where we surveyed 21 schools for the nutrition garden program. The father of nutrition gardens is right here. He had started it way back in 1970s in 50 schools of Delhi, and it attracted the attention of the Prime Minister Indira Gandhi also, and she visited some of these. It was a grand program, and we took a small step back in Kerala. We surveyed about 21 schools in our neighborhood panchayat that and we selected 10 schools were doing very well in the nutrition garden. We provided the inputs, the seeds and the technology. We visited every one of these schools, and every year we give award to the best school in that. And I must say that this is working very well. It has attracted the youth, and I think, as Dr. Swaminathan always used to say, the biggest challenge in agriculture is how to attract youth to farming. And this is one mechanism which we should emphasize. It should have gone in the previous session, but nevertheless,
Thank you.
I have told Raman also, and he has said he is going to start this program here.
Very good. Yeah.
Thank you.
Thank you for sharing that. Could you please pass the mic next to you? Yeah, thanks.
Nafiz Mir from IRI. Two questions, one for Dr. Mohapatra and one for Dr. Carberry. First to Dr. Mohapatra, you mentioned very intriguingly at the end about smallholder farmers and the numbers of them, but then didn't go on to express what you felt about what we should do. So it would be helpful to understand a little bit more about your train of thought on that. A second question to Peter, and that is, and again, you touched on it when you mentioned the word intuition, but one of the big dangers is that we technologize farming too much and lose indigenous knowledge. All this focus on apps and everything else might mean that we reduce farmers to almost robots, just following instructions from machines. Is that what we want farming, smallholder farming, to become?
We'll take a couple more questions and then I'll ask the panelists to respond. Please.
I used to work here in the early 90s in the foundation, so it's extremely inspiring to be back here. I was just reacting to Dr. Carberry's presentation, and I found it really interesting. I'm back from a visit to a place very close to Patancheru, in a place called Zahirabad, where there's an NGO called the Deccan Development Society, which is doing some amazing work with minor millets and pulses. So, and I also happened to be a part of the Deccan Development Society in the early 90s. So if Dr. Carberry, if you're interested, I can take you there. We can see the excellent work that they're doing. They got the Equator Prize recently. Thank you.
Yeah, good morning. Thank you very much, everyone. I'm Narsimalu, professor from Dayanand Sagar Institution, Bangalore. My off-tangent question to Dr. Peter. Sir, with this now developed and positive system of ecosystem developed for the agriculture, will you go back to farming now, sir?
Myself, Ashok Kumar, working for Germplant Evaluation at NBP, New Delhi. My little bit clarification from Dr. Peter. So, and ICRISAT released 44 varieties of chickpea through germplasm. So, I want to know if they will release through germplant selection or through recombinance breeding. What are the procedure?
Query to Dr. Rengalakshmi is, now you mentioned about collective asset. Now, what is the process of creation of this asset and ownership? And whether there is any difficulty in terms of, and what is the institutional foundation of that? To Dr. Bhavani, very interesting programs of nutrition garden, for example. Now, how these nutrition gardens are being accompanied by other creative efforts. For example, school nutrition garden, is it being accompanied by a kind of songs? You know, our Dr. Mia mentioned about indigenous knowledge and new language of food, world cosmologies. And it is in that spirit, I want to ask Dr. Carberry that this very language, like climate smart agriculture, on climate smart food, are we also invited to think about a climate soul agriculture, a soul food? And especially in the context of narrative, I would like to draw your attention, you yourself mentioned about risks in agriculture. Therefore, the narrative cannot be just one-sided success. So how do we build a narrative which includes both success and failure? And therefore, we have to create a narrative of hope. And here Dr. Swaminathan's idea of ecology of hope, I would like to suggest that how could we create a narrative of agriculture as a narrative of practical hope involving both success and failures.
Thank you. Thank you very much. We're going to, I'm going to hand over to the panelists for very brief responses, because then we break for coffee and come back again for much more discussion. So Dr. Mohapatra, you can start.
Yeah, Nafis, you have raised. In fact, while mentioning so, I thought probably it is best left to the audience to deliberate and give suggestions, how one has to go about it. But globally, people are doing, and there are examples of, pulling lands for making them bigger and sharing profits, and then also resources. So India is also thinking about land leasing. But then one has to see where these people would be going, the smallholders, how they will be observed meaningfully, gainfully elsewhere, or they are engaged as farm laborers in their own farms on the leased lands. So there are issues and concerns, and there is nothing concrete at this point in time. But certainly there are lands held by such farmers who are moving to cities, and they don't really want to cultivate, or their children don't want to cultivate. So there is scope to actually pull them through land leasing policy and go for contract kind of farming, and then bring those operations in big farms to this. It would require some more time to actually crystallize on this and have big moves in the country. So at this point, we are here to grapple with smallholder farmers, and that is why the relevance of discussing this further. And it cannot vanish overnight. 85% being smallholder, small and marginal. So this would continue for quite some time. So though alternatives need to be really looked into and experimented, and then the positives and negatives to be studied, balances should be drawn, and then move further. So that's what it is at this point in time. Thank you.
Thank you. Pass on to. You can go ahead.
This is in the collective is in the form of a self-help group. The group is registered under Legal Society Act. Then later it was federated, and federation is also got registered. So it's a kind of an system at the two places to facilitate the whole process. And in case of creation of asset, we facilitated them to develop a kind of a business proposal, and that was submitted to the bank. Through bank, they leverage the credit to build their assets. Thank you.
Okay, thank you very much for the questions. I'll try to address them quickly. Nafis, around Indigenous knowledge and where's smallholder farming going. Two aspects of that. I think if you listen to Professor Swaminathan this morning, he also talked about farming is about productivity. You consume some, but you also have to go for markets. And so farming has to have some element of business to it. And if people are going to be in business in the 21st century, they have to use technology and knowledge. So there's no doubt that farming in the future has to understand what technology is available to be able to perform better. I personally don't believe that we're going to lose Indigenous knowledge, because I refer to this idea that people in their cognitive processes don't just use analysis. They use their intuition built from experience. And that experience is always going to be driving decision making, whether you're a small farmer or anyone in this room here. And I think we need to spend much more time with the social scientists understanding cognition and the way people think as we develop our technologies going forward. And I think that's a big area, and I'm sure we're going to hear a bit more about that a bit later. I'm going to come and visit the Deccan Development Society. Yep, good. Thank you for the invitation. Would I go back to farming? Every now and then I go to bed at night and I think, could I have been a farmer? Could I have followed my father? My brother's on the farm now. And I think, nah. I would have. My father was right. I would have been a hopeless farmer. I mean, My brother has sat many hundreds of hours on a tractor going round and round in circles. Nowadays it goes ups and down. And they have self-drive tractors now, so he can be on his phone while he's doing it. But no, I've had a wonderful career. I've enjoyed being in science, but I still talk very positively about agriculture. I think agriculture has to be for the youth, and we have to encourage people to go there, and we have to make it less labour intensive, etc. So. Yeah, I don't lie awake at night very long thinking about that. I think, oh no, I've made the right decision. Pigeon pea breeding, ICRISAT uses all the technology available. Most of the varieties that we work with Indian Council for Agricultural Research at, the IIPR in Kanpur, are bred through conventional approaches, but we use molecular breeding more now as we identify traits. And we also are involved in GM. So we're looking at BT pigeon pea as a way of dealing with pod borer. So we'll use all the technologies available in our breeding programs. And ICRISAT with IIPR have released a hybrid pigeon pea. It's the first hybrid legume in the world, and it's a fantastic technology that can help productivity in India and elsewhere around the world. Lastly, the narrative, I think that was sort of the point of my talk, is about that we have to have a narrative around agriculture that talks about success, conscious about failure, about where we might not have succeeded. I love the idea of an ecology of hope. If you walk into the Bill and Melinda Gates Foundation in Seattle, they have some stairs there, and on the stairs it talks about being an impatient optimist. I like that idea that we have to be impatient optimists, an ecology of hope. We have to learn from the past. We have to acknowledge where agriculture is leading to problems through greenhouse gas emissions or through erosion or environmental degradation. But we can't be one-sided. That's my point around agriculture. We have to have a narrative that balances that. But on the whole, you've got to come out on the positive side. We've done a pretty good job, as Professor Swaminathan would say, in feeding the world and getting us to this point. And we've got to keep working on that. That's everybody in the room here's agenda.
Thank you. Last question, Bhavani.
Yeah, quickly. Yes, Dr. Giri, there have been several creative, responses which have come up in consultation with the community. Like we had a nutrition garden is accompanied by nutrition awareness, and that led to a drawing competition in the schools, and pictures from that were used to produce a nutrition calendar with messages in the local language, and then the children took it home and started insisting, the importance of different, consuming different foods, etc. Using songs, street plays. So there have been, several instances which have evolved.
Ajim Premji Philanthropic Initiatives, please come on to the dais. Dr. Rajib, please.
Okay, welcome back, everyone. So we have we have two sub-panel discussions this afternoon. Each one has 3 panelists, and I'm going to request them to keep their initial interventions brief, so that we can have more of a discussion with the audience. And let's keep in mind the theme of the session, which is science and technology to secure and sustain smallholder farmers' livelihood and nutrition and health security. So I'm first going to invite Dr. Narayan Hegde to make his remarks. And I request the speakers to restrict themselves to about 7 to 8 minutes for their initial intervention.
Good morning, the chair, dais, and all the dignitaries. India is represented, the Indian farming is represented by 87% marginal and smallholders. So it's important that we address their challenges. If we are able to help these small and marginal holders, probably there is no reason why we should be bothering about food security, because they are our major stakeholders. They are the ones who are facing challenges. Ever since independence, we have been hearing the plight of poor farmers in India. So I was wondering whether we will be really able to help the small farmers at all, or we will be only providing lip service through our technologies. That is, this was related to, I was searching for the cow slaughter in India, why it came. And I came to the literature that in the 18th century, Robert Clive, who is so-called founder of British Empire in India. He was the Bengal's governor also, he was viceroy. And when he came to India, he was amazed to see the successful farmers across the country. And he kept on researching why the farmers in India are prosperous. And he found that the farmers had integrated their agriculture with animal husbandry, and that was the reason, he concluded. In fact, that made him to think that if you want to disturb Indian agriculture, best thing is to disturb the livestock population. And that is how in the year 1760, he established a largest slaughterhouse in Calcutta with a capacity of 30,000 heads to be slaughtered a day. So that goes back to say that the wisdom says that mixed farming has been the answer in the past Indian glory. And as we separated agriculture from livestock, we started facing the problem. Now, when we talk of small farmers, there are advantages of small farmers as well as disadvantages. The advantage of small farmer is that they are very efficient. If you look to per capita crop production, a good small farmer has better yield than the large farmer. So they have available labor, and they also have the capacity to intensify the management of agriculture. So they will be able to harvest better. The bad part is they are inefficient in procurement, inefficient marketing. They are not able to get the latest technology. So if you want to really help the small farmers, apart from the technology, we also need to address these problems. We understand the strength and try to take advantage of it and try to address the weaknesses. And today I was very happy that two of our speakers did mention that livestock should be an integral part to be very successful. I do admit that. Apart from livestock, which is going to be mixed farming, also there is a need for promoting multiple crops. Whether it's household, backyard, front yard, or field buns, apart from growing the main crop, if we are able to, and which farmers have been always doing, then they have year-round engagement, they will have year-round harvest, and as a result, they are able to get a lot of food, nutrition, along with income. And they will be able to manage the climate side, smart agriculture as well, very intensively. However, it's very important that we promote right kind of technology. Very often, who are having stake in promoting our technologies, we are very anxious to push the technology whether it's good or bad. Our farmers have experienced this in the past. Jethro has been a good example how we pushed it. Strawberry cultivation, they were even American embassy was involved. But it failed because the technology was not perfected for the small farmers. Very recently, in the livestock sector, I would like to quote. Suddenly, the government of India declared that crossbred cow milk is poisonous, A1 milk. And as a result, they said Deshi cows are good. People started selling the Gesi butter for 3,000 rupees. When the market butter price is 300 rupees, people started selling. But farmer did not make money, it's a middleman made money. And today, there are farmers from Maharashtra who went all the way to get Sahiwal cows to Punjab and UP. As a result, the price from 30,000 went to 70,000, 75,000. They brought it. In 3, 4, 5 months' time, the cow started yielding less. It has a long dry period. And subsequently, they don't understand that the money has been lost. So the point I wanted to say is we are very concerned about the farmer, but we should not be impatient unless the technology is proven. For example, good example now is zero budget farming. Are we able to tell the farmer that we are bound to get profit out of zero budget farming? If not, why are we so impatient? This is a very important thing, because farmer, between the small farmer and the technology is a trust and credibility. Moment we lose the credibility of the farmer, then he will, whatever suspicious he is, he will become more suspicious. The technology adoption becomes very difficult. Another important thing is the value chain. The biggest problem today of small farmer is far distributed. He has to incur very high price for retail input procurement. He has to supply the surplus, small surplus. There is no market. It has to be created. So, and unfortunately, in Indian agriculture itself, as many of you have learned in agriculture college, we have calculated the profitability by multiplying the yield into price. We did not understand what is the market commission, how the distribution cost is, and as a result, value chain has been very weak link in the complete agriculture production system. And that holds good more for the farmer. And every farmer, whether he is big or small, including the farmers in Punjab, they expect government to manage their marketing, which is impossible. So probably one important thing is, like Ranga said, we need to really create farmers' body. I would rather think that you create a market first and then come back to production. And if we are able to facilitate good quality input supply, farmer will simply save about 20% of the commission, anyway, dealer's commission, by bulk purchase. And if we can collect and market it, again another 20%. See, 40% income can be enhanced simply by organizing value chain, good quality input supply, and collecting and aggregation, grading, and marketing. 40% he can get. Today, our Professor Swaminathan Commission said the farmer must get at least 50% profit over the cost of production. Simple value chain development can give you 40-45% income. And if we are really good with the farmer, today morning, Rengalakshmi presentation said 66% of the bore wells are owned by small farmers. It's a very, heartening note, If the farmer has bore well, if the farmer has access to technology, and if we can organize this value chain, then, I don't see, at least, 50 to 75% of the small farmers should be self-sufficient and contribute to the food production very soon. So a very important thing is, very often, I'm very happy, this morning we did speak about that. Very often we don't speak, we only speak of technology. It's important that the management has to be equally strong. Communication is another thing, effective communication. What's the new technology? Where is the market? What are the opportunities? So ICT is another thing. This again, if you are able to have farmers organization, somebody will be in charge. They will be able to get it and communicate among the farmers. Finally, before doing all the things, basically the small farmers have been chronically poor, and we need to address their basic questions. For example, in most of the small farming family, the women are the major workforce. Men won't move away. If we don't address the women empowerment, means provide safe drinking water, address the malnutrition of the women as well as children. Then health, very important issue. I was very happy the opening remark by the chairperson was on health. Many times people think, what's the relation with the agriculture and health? If these people are not able to work, then they cannot. They are not able to contribute. So if you can, and finally, if you are able to have some local people or mentoring, many times the technology adoption depends on the source of information. If our farmer has to depend on the taluka headquarter or district headquarter for the new technology, the adoption becomes very difficult. If you are able to train even a lady housewife as a guide or a unemployed youth as a guide, the farmer trusts them more than an agriculture graduate, because accessibility is more important whenever there is a challenge, because in the training many times you call the people without any challenges. They don't know what is the question to be asked. So as and when they can get the answer, that will be very effective. So I believe that very optimistic that going back to the 1760, Professor Swaminathan, I was going back to before he came, I said that since independence, since independence, I have never seen happiness of small farmer. They have been always poor. But going back to Robert Cleve's commission, the earlier British viceroy, 1760, he saw Indian farmers were so happy, so prosperous because of livestock and agriculture mixture. So it is a proof that we can make our small farmers prosperous, provided we take care of the other softer issues along with the technology, which is also very important. Thank you very much.
Thank you very much, Dr. Hegde. I now request Dr. Nitya Rao to make her intervention.
Yeah, thank you very much, Chair, members of the panel and friends. I think I'll start off with the ending point of Dr. Hegde on the importance of paying attention to women and who are the actual farmers. And it's just, I think, also to pick up a point that came up in yesterday afternoon session on coastal systems, when Dr. Shailesh Nayak at the end of his presentation showed a diagram about sort of the coastal areas, the natural resources, the policy and infrastructure, and also the human dimension, and mentioned that where we know least is about the human systems and the human dimension. And I actually wanted to focus on this, and also to say, to start off with, that even when we talk about communities or human beings, I think we need to recognize that they are diverse. They are not the same. We have spoken about smallholders, landless and landowners, which Rengalakshmi mentioned in the morning. There are women farmers, there are men farmers, there's of different caste categories, and all these make a difference, especially in Indian society, and how people are able to access resources and what are the choices they are able to make. So I think Dr. Carberry spoke about intuition and experience, but also people's experiences are very different depending on their own social positionality, and I think that is something to keep in mind. So globally, I think there's been, I'll speak about gender and gender justice as an example. I think globally there has been a lot of awareness over the last 30-40 years since 1975, a lot of progressive policy change, especially in education, political empowerment in India, inheritance of land, and so on. But a lot of issues remain, and I think these issues are really focused in the area of health and nutrition, poor health and nutrition, which has also been called the South Asian enigma, that India has been doing very well economically, but the health and nutrition has been stagnant. And on the left is a diagram actually from the last year's economic survey of India, which really talked about the continuing decline in child sex ratio. So sex ratio is the survival of the female child vis-a-vis the male child. And in India, we have been having a declining trend, and this is continuing to decline. But what's happening now is, rather than discrimination post-birth, which used to be the case earlier of girl-child neglect and so on, now it has moved to pre-birth, where a lot of selection takes place, what the economic survey called as meta-selection, or son preference to meta-son preference, that the choices are made prior to birth itself. And I think this actually influences, to some extent, the outcomes in terms of poor health and nutrition, and a set of related fields. And I think we've been talking about this need to link up. So link up education, link up health, but also I want to focus on devaluation of women's work in particular. And in fact, there was also a WHO report earlier this year that talked about the health pay gap within the health workforce, that huge gaps that the women are delivering, but the men are leading. And there's a huge gap in terms of decision making, who's leading, who's got the leadership positions and the higher salaries, and who's actually delivering on the ground, and including the knowledge and the training gaps therein. So devaluation of women's work across sectors, including the health sector, including the farming sector, unequal access to assets, and I think I was pleased that Rengalakshmi spoke about the collective assets and so on to help women overcome some of these biases. And very important, I think, which is linked to health, which we don't like to speak about, is violence, that the growing violence against women in different forms. In the newspaper, of course, we read about rapes and so on, but also there's an everyday form of violence which is showing up in terms of nutritional and health inequalities. So India, I think, within South Asian context, is actually one of the worst in terms of the prevalence of double burden, doing much worse than Afghanistan, Bangladesh, Nepal, and so on. So in most of the indicators, whether it is undernutrition, overweight, obesity, anemia, and so on. And of course, there has also been, while the National Family Health Survey shows improvement across a range of indicators, actually in child wasting, there has been an increase over the last 10 years. And I think this was my point about diversity, that this is not the same for all over India, but there are clearly pockets and there are groups of people who are doing particularly badly in terms of child stunting, wasting, all the undernutrition indicators. Scheduled tribes and tribal populations with whom I have worked for a long time and also has been the focus of a lot of MSSRF work across states are some of the worst in terms of outcomes, and most belong to rural farming households. Feminization we have often spoken about, it has been mentioned. And I think there are 3 points that I really wanted to make. One is that while we all acknowledge that women are involved in farming activities, but often they are working as what we call in Indian statistics as unpaid household helpers. So neither do they receive an income for their farm work, nor is it properly acknowledged and supported. And I think one of the key themes that has been coming up is that therefore, while they are workers, but because they don't get an income, there's no empowerment effect in terms of decision making and so on around it. They're seen as some kind of household help whose responsibility it is to do agricultural work. A lot of the work that women do is labor intensive, involving drudgery. And I think in technology development, there has been less attention paid to reducing women's drudgery in terms of farming work. In fact, a lot of the technologies, including sort of improved, sometimes agricultural practices, I think weeding is significant, improved varieties, improved technologies. Actually, they don't take into account where it might increase women's work burden. And the third aspect is we all forget that apart from farming work, which is full-time, and Ranga also spoke about diversification and other income generation activities. So most women, in addition to farming, are doing some kind of home-based work to earn some income because their agricultural work doesn't bring in an income. They also are fully responsible for household and domestic tasks. What we call as reproductive work, fetching water, fuel, cooking, feeding. And I think some of the work done by especially my mother, Soumya Swaminathan, really showed about that lack of time for feeding is in fact one of the big factors responsible for child undernutrition. Even if they have food at home, women don't have the time to cook and feed. And this is completely overlooked in all our debates on agriculture and nutrition. Bhavani already mentioned I was involved with the LANSA study, and the 3 headline findings from a study that we did on time use and diets in 2 regions, which Bhavani talked about. One is that we found that of the total work, which we calculated, that women were doing 56% of the total work, and this included actually 75 to 80% of the agricultural work. So while our statistics show that women are 60% of the farmers, that was the figure that Ranga presented, as per time use, women are actually doing 75 to 80% of all agricultural operations and 95% of domestic and care work. And therefore, we know within farming and agriculture that these are seasonal, and we found seasonal time deficits for care, more, almost 30%. So they have to do their farming work. So what they cut down on is the domestic work, which is the food preparation and feeding. And I think this is one of the key factors leading to continued high child undernutrition rates. And plus, of course, on women's own health, that we found actually when we calculated that they were encountering seasonal body weight loss of 3 to 4% of body weight. And I think 1.5 to 2% is supposed to be all right, but 3 to 4% is seen as quite significant in terms of their own health and so on. So I'll just kind of conclude with one of the things when we talk about gender is actually a lot of the focus is only on women and women's work. And I think in this context where smallholders and agriculture is in a crisis, they're struggling to survive, when we're looking at gender, we also need to look at the relational contributions, at what are men contributing and what are women contributing. So far I have spoken about women. One of the key reasons is that because the prices and so on for agriculture have not been very remunerative, a lot of the smallholder men are actually migrating out. So they're not present in the villages. And that is one reason that women are taking a bulk of the load. These men are not working in very good conditions either in urban slums or in other rural contexts. They are also working without any leave and so on. And in our research, actually many of the women reported that when these men migrate and come back, actually they come back with poor health themselves, and they don't have very good diets wherever they are. In fact, male dietary diversity in tribal populations, according to NIN study, is less than female dietary diversity in the village. So men have poor diets, they come back ill and bodily wasted, and therefore in addition to all the other tasks, women are also looking after the men, and that's one other reason that they're not able to contribute to farming. So I think there's a key issue when we're talking about gender. It's also about male health, the quality of work, in migrant contexts. How do we also simultaneously advocate for decent work conditions as per ILO guidance for both men and women? So that's my concluding slide, that for research, I think, and for MSSRF and for research, we need to pay more attention to the contextual factors, the type of crops, the cropping choices, intra and inter-household variations, what are men doing, what are women doing. And all the existing studies actually are not very conclusive in looking at agriculture and nutrition links, partly because they don't pay adequate attention to the differences that we find on the ground with particular social groups and different agrarian or farming systems, which we were talking about. We can't have the same solution across farming systems. And also, I think I would really like to make a plea, being a social scientist myself, that the large-scale surveys really need to be combined with much more qualitative, smaller-scale methods, intensive ethnographic methods, which really can provide solutions of what's happening on the ground, how are people responding to change, what can we learn from their practices, and how can we adapt it at a broader level. Thank you very much.
Thank you very much, Nitya. I'll now call upon our third panelist, Mr. Rajiv Kumar Raul from the Azim Premji Philanthropic Initiatives.
Respected Professor MS Swaminathan, dignitaries in the dais, and ladies and gentlemen. Sir, I read about your name and the Green Revolution when I joined agriculture in the year 1994. So now I am going to present about the work we are doing in the state of Odisha, related to life cycle approach, related to 1,000 days, related to Nutri-Garden. So we have discussed so many things for last 2 days. I am going to share that in presence of yours. So in Odisha, we are going to support the state for coming 10 years, and our focus is how to reduce the malnutrition of the state. So stunting we have taken into consideration. So that is our plan in the state of Odisha. Why we want to promote dietary diversity? If you see this research paper, across all the quintile, carbohydrate intake is more or less same. But if you see the fruit, vegetables, dairy product, beans and other things, it's very different. So we need to focus this thing, and we want to ensure this by promoting this Nutri-Garden which we are talking. So in Odisha context, when I am talking about Nutri-Garden, it is including goat rearing and also backyard poultry. So all three together we are saying as prototype in the dietary diversity context. So this is the situation of Odisha as per NFHS 4 data. And mostly the southern part of the Odisha, they are dominated by the tribal percentage. And see across there, the situation is red. In Odisha, we have identified 10 different departments. So generally when we talk about nutrition or health health and women and child welfare, generally they used to talk about these issues, but not the other departments. Now agriculture department, RD department, they have started discussion about nutrition and malnutrition. So these are the 10 departments we have identified, and we have identified 65 different schemes which are directly or indirectly related to the nutrition issues. So in Odisha, Government of Odisha, they have developed called Odisha Nutrition Action Plan, and all these 10 departments, they are trying to achieve as per the plan. We started this thing 3 years back. So first, we have piloted this Nutri-Garden concept in 2 districts of Odisha, Kalahandi and Raigada, with a partner called Living Farms. So they have demonstrated this idea. That was only Nutri-Garden. Backyard poultry and goat was not there. So they have demonstrated with around 1 lakh household in these 2 districts. Then we shared this thing with Odisha Livelihood Mission. So that is the state SRLM, and they are doing the women SHGs, and health and nutrition are 2 important components as per the NRLM guidelines, as per the Dasasutri guidelines. So then we are having a partnership with Odisha Livelihood Mission. So coming 3 years, we are working together, and 3 resource NGOs identified along with Living Farms, Pradhan and Harsha Trust. These are the other 2 resource NGOs. They will be supporting to Odisha Livelihood Mission, where we will achieve 7.5 lakh households, approximately 40 lakh population in coming 3 years. And this program will be implemented throughout 30 districts across the Odisha. Then the plan is OLM will continue this work independently after the completion of our partnership. So right now there are 3 verticals under Odisha Livelihood Mission, and we are supporting the nutrition vertical. So we are 97 dedicated staffs will be there for this nutrition work, and there will be 7 state level officers and 3 each in district level to support these initiatives. So 3 aspects here. We are ensuring the consumption of fruits and vegetables, focusing on women and children. So for that, individual household visit will be there by the cadres of OLM. So whatever they are growing in the field, in the Nutri-Garden, whether women is consuming or not. So that is the most important part here. We are not adding any new cadres or new new HR in the structure. So we are working this with the existing OLM cadres. So 9,000 cadres will be trained. So they are the CRPs, they are the Pranimitras, they are the Krisimitras. So they will be working with the SSG members for this particular program. So there will be an awareness. So there will be 2 components. One is the PLLN component, which I will share later, and second one is the implementation part. So here we are using only the local varieties. So 13 different varieties of vegetable seeds distributed to this household to grow Nutri-Garden in this particular Kharif season, and no hybrid, no yielding seeds will be used in this program. And they will not use any chemical fertilizer or chemical pesticides also, because it is meant for the consumption. So they will use the locally developed pesticides or fertilizer for this particular thing. So these are the different food groups we are focusing. If they grow Nutri-Garden, backyard poultry and goat rearing, and PDS is there, so at least 5 to 6 food groups will be ensured, at least. So that's why when we are selecting the vegetables, these are the factors we are keeping in mind. So that's why I said this season we have distributed 13 different types of vegetables. So that is the main idea behind it. So to create awareness, these SSGs members, they have their weekly meetings. So out of 52 weekly meetings, 14 weekly meetings will be dedicated for the nutrition and HNWAS related topics. So these are some of the photographs where we have trained the master trainers who will be training to the cadres for these PLLN meetings. So these are the different 14 weekly modules. So that is related to HNWAS. These are the 14 different PLA meetings. So this is the component of NutriGarden. So these are the two models we are demonstrating in the field. One is the circular model, second one is the rectangular model. There will be 7 beds. So 7 means 7 days in a week, 7 different types of vegetables. So that is the context. That's why this type of structure. So these are some of the photographs which we have taken last week. We have been to 3 districts, Sundargarh, Sambalpur and Keonjhar. All these photographs are taken from those districts. These are the seed kits. This is one model we are promoting. Those households who are not having any even 2 cents of land, with them we are using these gunny bags so that they can also have the creeper vegetables to ensure the vegetables. So fencing is a must because poultry is integrated. So that's why we are ensuring fencing. These are the cadres. These are the Krishi Mitras. So first they are trained and now they are working with the SAG members to promote the NutriGardens. So in this particular village, these 4 households, they are doing this NutriGarden in a common place because 3 of them, they were literally landless. They don't have any land. So other member, she has given the space to grow NutriGarden. These are some of the organic things they are doing. And livestock, we are basically ensuring how to reduce the mortality. So vaccination is ensured and preparation of certain feeding materials. So thank you very much.
Thank you very much. So Rajiv, very ambitious initiative, and I hope there will be ongoing monitoring and evaluation so that we can learn from this big, large-scale experiment. So I think we have a few minutes now for some discussion and questions to the panelists. I think each of them have raised very important issues around understanding the local context, especially looking at gender differences and trying to, we cannot talk about improving the lives of the farmers unless we understand what it involves on a day-to-day basis and what really their needs and challenges are. And as far as nutrition is concerned, I think we've heard a number of different examples of how we can improve nutrition through improving the local farming systems and promoting nutrition gardens. But very important component of nutrition education. I think Nitya's point also is that many of these things we're adding more burden on the women. Because I'm sure the rearing will be done by the women, the nutrition gardens will have to be maintained by the women, and then they still have to find the time to cook and feed their families and themselves. So we need to look also at what the cost is of all of these interventions and how can we make it easier. One thing that nobody mentioned was about, again, using digital tools and technologies to make, especially for educational purposes. Almost, there's a mobile phone uptake in our country is extremely high, and I'm sure a large number of these families also have access to a mobile phone. And really thinking about how we can deliver more through that. I mean, everything cannot, like someone said this morning, developing an app is not a solution to the problems, but certainly it can help where there are gaps. I see Amit, would you like to make a comment or a question? Please go ahead.
Yeah, it's a quick comment, on this panel's thing. I'll start off with what Nitya said. I mean, the hidden forms of violence against women, and I think, Soumya, you'll agree that child marriage, especially in the tribal areas, both in Odisha, I've worked in Rungapur, Odisha, is one of the worst forms of child marriage is one of the worst forms of gender violence. And it has implications for nutrition or malnutrition. And one finds that with all the state and governmental interventions, the non-governmental interventions targeted towards men farmers, as prosperity goes up, these hidden forms of violence increase. underreporting or rather over-reporting of the age, but if you probe into the field, the age at marriage is going down. I have empirical evidence for that. The cloistering and withdrawal of women from the labor force. So that the woman who kind of, would go and gather, say, some roots or something, that stops from the forest. The other major thing that the way the interventions proceed is that there's a tremendous degradation of the ecosystem. Sometimes, we have NGOs, I don't want to name any, I just saw a list of them, who are promoting eucalyptus in lands which were traditionally under the domain of women, and the same NGO again involved in nutri gardens. So unless we look at it very holistically, we can't solve anything.
Thank you for raising a very important point about child marriage. My own experience also when I went to the villages in Wayanad was that there's lack of opportunity for young people, and often that leads to either early marriage or early pregnancy, and it may not even be a marriage, but yes, the girls are getting pregnant and having children very early on, because really after class 10, the opportunities for these tribal youth are very, very limited, either in terms of further education or other vocational opportunities. Many of them don't want to continue in agriculture, unfortunately. So we really need to look at the needs of the young. So there has to be incentives and disincentives, I think, for child marriage. You want to come back with something?
My experience, almost throughout the country, except in the Northeast, how many tribal women across ages, A, have access to mobile phones, and B, even when they get the mobile phone, they don't have these, what do you call them, those, the contemporary ones where you can have an app. Smartphones. I mean, there's this tremendous divide, gender divide, in the distribution of mobile phones and the access to it.
Absolutely. No, I think that's a very important point. The digital divide could actually become a very big factor, and if there's a gender factor there, we need to really study that. Okay, we have two over there, please, and then Dr. Iyer, quick points.
Thank you so much, Professor Nitya Rao. In your very deep presentation, you are also inviting us to look at spaces of intergender care and solidarity. It is in that spirit, one dimension also we need to bring in the dimension of generation. And therefore the vulnerability of the old women, and so therefore not only in terms of old but also young, so therefore that generational kind of solidarity. But in all this, what is your conception of subjectivity? Because the story that we are receiving is mainly a story of victimhood, but in real life conditions, women are also creative subjects and co-subjects. Thank you, Rajiv Ji, for your very deep presentation. My query is that even while doing fencing, for example, the fencing can be done through floral fencing. The point is that in this, what is the aesthetic dimension? If you are also hinting at that. And about, you said that the meetings are devoted to modules of nutrition. And what is the cognitive dimension? What is the knowledge dimension? Because so far the self-help groups, they have not been linked to learning practices. And I wish to know in your approach whether you are bringing the knowledge dimension in a systematic way.
Thank you. We'll collect a few questions and then I'll ask the panelists to respond.
Yeah,
go ahead.
Thank you, panelists. I think all the presentations were really insightful. I'm Prajna from World Food Program. Just a couple of comments, not really the questions, specifically one for Nitya. I think you really brought out a lot of gender issues. I just want to actually point out still the narrative doesn't talk much about involvement of men in the care, specifically when we are talking about women actually are overloaded with work outside and inside, and then the time to really feed actually gets reduced. So we actually have to promote a positive message as well, that a parenthood actually is a kind of enjoyable thing, and male equally can participate. So somewhere actually, I mean, that narrative, though at the conceptual level is there, and it doesn't really percolate down into the messages. And I think more and more work towards that is really required, breaking the masculinity and those barriers. For Rajiv, I think your presentation was really very good, very comprehensive, and I think we really all look forward to the results of that. Just wanted to ask you and whether you have a collaboration with Mission Shakti and those kinds of groups as well, and to what extent it is also linked with the overall nutrition mission and those kinds of initiatives in the state. And again, I mean, looking at the gender dimension, to what extent you are really looking at, because usually, again, I mean, as the previous question was related to technology, at times, I mean, when it comes to technology, the information actually is stopped because of access to technology for women. But when it comes to actually ground level work, she is the person who really is expected to do. So how you are dealing with those? So that is, thank you.
Okay. What? Hang on, you had a chance. So maybe over here, Dr. Iyer. Brief question, please.
Mr. Raj, you're planning to extend your Nutri-Garden program to schools also, because that will be very important, that whole concept to start from the youngsters. If the school is able to spare any small plot, you can train the students and provide the inputs. And I think that will be a good program, because you already have a program on Nutri-Gardens.
Yes, please. Yeah, Doctor.
Thank you, ma'am. I have 3 supplements or the comments. Dr. Hegde ji has raised a point in the value chain and input-output to promote the small farmers. Yes. Now, a recent trend has been community-based organizations, maybe FPOs, maybe CBOs. That perhaps has been taken by Government of India also recently in a recent budget. We have to make use of it, that as many number of FPOs or community-based organizations is one side. Second is community-based organizations. Both are called CBOs. Maybe you have to declare. That is the one aspect you have to look into. And so one question was there to the respectable Swaminathan, is modernization of agriculture is affecting the biodiversity? It is partially yes and partially no. Conservation alone may not meet the requirement of the nutritious food to the people. It is their utilization, maybe tuber crops in the tribal areas, maybe pulses and other things. So now the concept is let food be the medicine rather than medicine be the food. So the Nutri Garden, which has been already being promoted by this one, is another area which should do it. And for the morning decision, there appears to be a divide between the agricultural, the advanced technical science and the social science. Social science is totally sidelined in wake of technology-heavy approaches. Unless the social science is taken as a partner to reach the people, probably our technologies remain either due to the inefficiency or due to the gap and other things. These 3 things can be a group together as a supplement to reach the unreached farmer to double their income. Thank you.
Thank you. We'll have to stop now, and I'm going to ask each of the panelists to just respond in a minute or so.
Yeah, thank you. I think I totally agree on the issue of generational. I had just a few minutes, but absolutely, generational cooperation. The narrative about men, I think we have it in SDG 5. One of the targets in SDG 5 is around unpaid work and the redistribution of unpaid work between women and men within households, but also across other social institutions, including the state, community, and markets. So I think we do have to build. So it's there in the SDGs. I think we have to work much more in terms of creating positive narratives. I totally agree with that. And the only other thing I wanted to say was, yes, I think it was not about victimhood. I think women are very agentic. That's the way they're surviving. There's everyday agency. There's everyday ways in which they are making ends meet, in which they are keeping their families together. But unfortunately, it's often coming at the cost of their health. They don't prioritize their own health. And I think this was a discussion we had with another group, that women may be very empowered, but I think all their aspirations are directed towards their children and not towards their own health and nutrition. So I think there is a paradox there, that they are very agentic, but they neglect their own bodies.
About the fencing, our goal is to go for the natural fencing, so that we are trying. one of the most important thing is to how to build the knowledge base of the women. So for that thing, we are promoting participatory learning action and linking agriculture to natural resources and nutrition. So 14 weekly modules which we have developed. This will be delivered in the SSG platform itself by the community resource persons. So community resource persons, they are now trained and they will be having one flip book. So when they are going to the SSGs, they will use those flip book to transfer the knowledge to the SSG members. And also we are taking help of the digital platform. The same modules we are trying to develop with the help of Digital Green so that it will be easier for the women to understand those issues. That is one. And we are having collaboration with Mission Shakti also and with the 10 departments also. So Odisha has established Nutrition Secretariat. On quarterly basis, they are monitoring the progress of the nutrition in the state. So in those meetings, so Principal Secretary and Secretaries are the members, and Chief Secretary and DC, they are monitoring the meetings. So in those meetings, we are sharing this thing. One of the important requests from the School and Mass Education and Tribal Welfare Department and from the Women and Child Welfare Department, when they learnt about this particular Nutri-Garden program, they have requested to establish this Nutri-Garden in each Anganwadi centers, in all the residential schools, tribal residential schools, and also in the schools. So we are in a process how to demonstrate this thing in those areas. About the technology part, we have already used this technology with the first partner where we have piloted, and same thing is in the plan with Odisha Livelihood Mission. Thank you.
I did not have any specific question. What I wanted to re-emphasize is this approach of empowering the women is possible, provided we take the men into confidence that it's a family development rather than empowering women alone. And second thing is if we can provide some scope for them also to come up with their ideas, traditional knowledge, the involvement will be faster and better. Thank you.
Thank you very much to this all the three panelists for a very, very interesting discussion. I think we need to move on now to the second one. Let's give them a big hand.
Let's move forward to the next session. Now I call upon Dr. Livelihoods, Senior Program Officer, Agriculture and Development, Asia, from Bill and Melinda Gates Foundation. Also, I call upon Dr. Suman Sahai, the chairperson of the Gene Campaign, NGO, and Mr. Madhusoodan Rao. He is the head of Nutrition Division from Tata Trust. Please come on to the dais.
So we'll continue with our discussions on the same theme. I want to invite Dr. Livelihoods from the Bill and Melinda Gates Foundation, Senior Program Officer on Agriculture Development, to share some of her insights. Again, I would like to request all the three panelists to keep your initial interventions to 7-8 minutes so that we have a little bit of time for discussion. Srivali, please.
Thank you so much. Thank you so much, Dr. Soumya, and it's indeed a pleasure and honor to be able to talk at this August gathering, but also at the time when the foundation is celebrating its 30th year, and in front of Professor Swaminathan. And just a brief snippet that I did want to share was that one of the things that inspired me to join agriculture was a very early talk that I listened to Professor Swaminathan in the IRI campus in early 1990s, which was actually something that made me, despite being raised on the backyards of Indian Agriculture Research Institute in Pusa campus, it was always like, that was almost like a playground. But when listening to Professor Swaminathan in that, and what changed I should say, that changed the whole agriculture for not only India but for the world, and to listen from the person who had done that, it was truly inspiring and something that keeps you really motivated that this is a sector that can have long-term impacts for people's life in the world. So I would, in line with the chair's request, I would like to keep my my conversation fairly focused, but also in the time, like, not giving a very formal presentation, but to just share some of the thoughts that are really being resonating since morning today. We've all seen that how the fruits of green revolution, but also in terms of the research in agriculture and development, had led to increasing agriculture productivity. They led to increase in intra-regional and inter-regional trade. So effectively, they brought down the risks of famine. But what did not happen was the change in the quality of diets. What we continuously focused was, let's look at increasing the food consumption. The food consumption definitely increased, and if we see what happened in 3 decades before and what is the food consumption pattern now, the food consumption has increased, but the quality of the foods that are being consumed has not necessarily changed, or in fact it has deteriorated. With more and more subsidized carbohydrates and fats and the interventions around ultra-processed foods, there is even more risk around double burden of malnutrition, which again increases the risk of diseases such as diabetes, hypertension, cardiovascular diseases. And just the professor said today in the morning that agriculture, nutrition, and health convergence is a critical need when we have to think about how we look at our society as a whole. We are not only a society that looks at improving one aspect, but at a household level, all of these things converge together. Today at a household level, there might be an Anganwadi worker or a health worker who's going and giving some programmatic interventions around health. There is a touch point by the agricultural extension worker. There is a touch point by some of the state rural livelihood missions providing information around nutrition. But what we do not understand, and we fail to sort of challenge the system's core, is that all of this converges at the household level. One of the things that are looking at, particularly when we talk about agriculture, nutrition, and health, is the interrelationship is extremely complex. And to add to that is the role the markets are playing. There is enough empirical evidence that now even in rural areas, 70 to 80% of food consumed at household level comes from the markets. Which means that while we were initially thinking that the farmer are eating what they are growing, that whole notion has to change. Even if you visit the most distant village or block from the center, the district headquarters, what you can see is the invasion of unhealthy, ultra-processed foods in smaller package size, which are being consumed by young children, which are being consumed by women, which are being consumed by adolescent women, who in turn become pregnant mothers in few years, which means that what we are adding is more and more carbohydrates, more and more fats, but not anything nutritionally valuable in that foods. When we are talking about science, and when we are talking about science and technology, to integrate and provide that cohesive linkage, we also have to understand that there is a very critical pathway that we often ignore, which is the income pathway. We always see that we have to keep giving messages to a household, you should eat healthy, you should eat more fruits and vegetables. But what if that household's income is so low that whatever they are producing, they are selling it for survival? Our messaging is not really making a real difference. Another thing that we are also seeing is, as we are talking about millets, we are talking about these really nutritive food crops. If we look at the economies that is happening around the country, who are the ones who are driving the consumption? These are people with higher income who have more choices in terms of diverse food diets. So invariably, the income pathway is critical to even provide them the opportunity to choose from a diverse diet standpoint. And in this concept, I would like to introduce something what we call as an adaptive learning. In so many years of development programming in country and in around the world, what we have always existed is a two-dimensional approach. We have seen that there are two dimensions whenever we are talking about designing and implementation of a program. We think about uncertainty. We think about that, is this a possible causal of a problem? And is this a possible solution to the causal? So a relationship between the problem, the causality, and a solution is always looked at from a very two-dimensional approach. We look at, okay, there is uncertainty, maybe this is the causality for that problem, maybe these are the issues that why there is a problem around malnutrition, there's a problem around association between agriculture and nutrition. We also have the second dimension around disagreement. We do not think that this is the right approach. We do not think that just forcing people to start just messaging around good eating habits will not have a long-term impact. But the third dimension in most of these design programs that we are missing is the system stability. At a household level, there is always a tendency to go and come back to your normal or what your system has always been done. We would be very normal eating rice. We would be very normal eating chapatis. We do not want to, we can eat millets maybe for a few days, but we want to go back. We do get the cheaper carbohydrates, so we want to keep going back. So that is the system stability which a majority of the programs are not addressing. And to challenge the system co, we have to take the third dimension into view from the start, from the point where we are designing a program, from the point where we are implementing, but also not stop there. We have to learn as we go, and that is what I am sort of like, really looking at this entire ecosystem today and the level of expertise that is present in the room to be able to challenge the status quo and to start thinking in a slightly different way and looking at from the system side, looking at things that can be doing together. It's extremely hard to let agriculture, health, nutrition, education, all these people start sitting together and look at that. Look at the problem together. But what is even more complex is to get the real end user and be a part of a research problem design, which is what we call as a participatory design, because this is critical in this context where the real affected party is the household itself. When we say about markets, it is critical, but the need for multiple stakeholders in that aspect is also important. What we can learn from the private sector, we should be able to emulate those learnings and establish those along with when we are designing some of these work around nutrition. Dr. Soumya mentioned that key determinant of disease burden is unhealthy diet. But if we have to change someone's diet, a pure science and technology approach around technology pushing will not only work. We will have to look at the science of behavior change. We will have to look at the science of communication. We will have to look at the science of product design, or design communication around how that product is even adopted by a consumer. But also the science around evaluation and how we are evaluating the adoption and what drives some of these adoption methodologies. Last but not the least, I would like to mention that one of the things that we've been challenged at the foundation is to look at how can we influence a quality food system design. What are the initial factors that are looking at from the point of production? Is for the market or for an uptake, because that is what is driving his production decisions. Is he consuming what he is producing, or what he is consuming, is it coming from the market? Is it coming from somewhere else? And what are the market linkages? Where is the product moving from the production side to the market, to the end consumer? And what do these three levers play in terms of influencing diets and eventually long-term nutrition outcomes? And with that, I would really like to summarize that it is important that we take a very holistic approach. We do not want to see a very siloed approach of let's talk about agriculture, let's talk about nutrition. Oh, really, we now have to start connecting. The aspects around gender, the aspects around social behaviors, these are very, very critical. And it is time that we realize that science and social scientists are not separate. They have to be working together, because for something to work, it is important that both these aspects starts coming together and for us to challenge the systems go. With that, thank you again.
Thank you, Srivalli. I now request Dr. Suman Sahai, Chairperson of the Gene Campaign, to make her intervention.
Srivalli has raised a lot of the points that I intended to address. Thank you. When we talk, the no-brainer in the room is the nutrition garden, millets, etc. The point is, how do we go about it? And I'd like to share the experiences of Gene Campaign in Uttarakhand as a sort of microcosm of how we have tried to address some of these issues. Talking about millets, yesterday Soumya and I were talking about millets. Who millet, what millet, which millet, PDS millet, National Food Security Act says millet. Who's growing the millets? Which millet should they grow? Where do they get the seed? And these are the real reasons why millet cultivation is not taking off in the northern states. I mean, the southern states are a different ballgame altogether because they've been eating millets. In the north, we've abandoned them and we eat only white rice and white sugar and maida. So our challenge was who's going to cultivate the millets and why and where the seed. So we started 2 programs, so-called technology programs. One was participatory varietal selection, in which we tried to collect as many traditional varieties of millets, barnyard and finger millet in our case, and whatever the institutions could offer in terms of so-called improved varieties. And we brought in about 12 to 15 varieties in one place and gave farmers the opportunity to come and evaluate these varieties according to their own farming conditions. Now, this farmers are almost never ever exposed to. They never get a chance to see more than the 2 varieties or 3 that are growing in and around their region, and this was hugely successful because they were able to see lots of varieties at their doorstep and evaluate whether they wanted to cultivate it for fodder or for food or for grain or for whatever. And so this, when we talk of technology, we don't have to get behind a telescope and look at the stratosphere for something really high tech. PVS, participatory varietal selection, is a technology. It's a technology that is very accessible, and it's a technology that can be easily adopted. And we find that with our work in Uttarakhand, it's made a difference. The other thing that we tried to do was adapt the principles of SRI in rice to millets to see whether you see a similar response. Do you see increased tillering and branching, and do you see increases in panicle, grain? Yes, you do. As in rice, there are varietal differences. I mean, I wish to dispel the myth here that SRI in rice always leads to higher production. It doesn't. There is a varietal response. And that's the kind of research and technology investment that you need in real life to be able to get which millet varieties, if you're working with millets, will respond and under what conditions, and give the farmers the chance to choose. If you do that, chances are that they will start looking at this as a viable option. In Uttarakhand, it's taken us 3 years of doing these experiments, introducing these technologies, and for the first time in this Kharif season, we've been able to really have a tremendous rise in millet cultivation. That's been very gratifying because this kind of technology exposure enabled the farmers to make up their own minds and to figure out that this was something that they could invest in. The other end of why they thought they could invest in this was the kind of value addition programs that Gene Campaign is doing in converting millets into products that people today want to consume. And here we ran into a roadblock. We work with women farmers, and we've organized the women farmers into samitis. And when we held meetings with samitis about eating millets and reintroducing them into family diets, almost to a woman, they said that their children don't want to eat rotis anymore. And so we asked them what do they want to eat, and they want to eat that dreadful abomination called a kurkure. So we said we will make millet kurkures. And we did. And the children can't eat enough of those. I don't care how you eat it, just eat the damn thing. So millet kurkure works. And if you can do that in your community, if somebody wants to make a laddu, I mean, be my guest. We are, by the way, doing laddus and barfis and kurkures and such like. And don't tell me this is junk food. It's not. It's millet. It's very healthy food. So this is how we've tried to approach this. Now, the big problem here is millet processing technologies and millet processing equipment. They don't exist. There are a few companies in South India But by the time I've schlepped it from Salem or Coimbatore to 6,000, 7,000 feet in Uttarakhand, I'm broke. And that guy, he doesn't speak any language that I know, and I don't speak any language that he knows, and we cannot come to an agreement on whether they will give us an after-sales service. I mean, these are the practical realities of technology adoption. In any case, the technologies that exist for something like 2 tons an hour. Now, we do 2 tons in a year. So we talk to fabricators in Delhi, people who do machines, of course, for rice, wheat, and maize. And we talked to the agricultural engineering institutions. We battered the doors of Bhopal and Ludhiana, Sifet in Ludhiana. They don't do machines for millets. So you have 2 choices. One is to buy something for rice and wheat and try and tweak it. If you're lucky, it might work. In our case, the machines were too expensive to run the risk of it not working. So we are doing this kind of trial. We worked with the fabricator who said, okay, I can try and bring down the scale from 2 tons or something to 500 kilos, which of course is also very high. But the answer that we got from them is that we can do it, but we will lose efficiency. Now, do you want a smaller, inefficient machine? You don't. So the real challenge here is equipment. And you need small-scale equipment. You need equipment that can run on a 1-phase motor because that's all the electricity that you have. You can't have a complex machine that requires a 3-phase motor. These are the practical problems that we run into with accessing technology and equipment and utilizing it. Now, on the subject of, I will say that we've beaten it to some extent, but not entirely so. But I think that when we talk about technology adoption, technology development, for hard-to-reach states like Uttarakhand, like the Northeast, and this applies even more to the Northeast, you will have to build into the technology package, you will have to build in transportation and marketing. Now, I don't suggest, and Dr. Hegde suggested that government cannot market it for you, and I agree, government cannot market it for you. But in trying to develop a technology, now, I can't on my own, Gene Campaign can't on its own schlep a machine from Salem to Uttarakhand. What I will get reimbursed, if I can get a grant, is the cost of the machine and some transportation. But it's very, very difficult. And transportation in areas like ours, there's no public transport. There are 2 buses in the day. One going in the morning and one coming back in the evening. So any private transportation is extortionist. It's so expensive. So transportation, without laboring the point much further, transportation will have to be built in to any kind of technology support program that we ask for, and we should build it in as an ask in whatever we are wanting support for. To come to what kind of technologies we want to use, I mean, clean drinking water, of course, again, is something that we've all talked about. And clean drinking water, do you know what's being promoted largely in most places? Is reverse osmosis. This is how you have crackpot policy. So you will get support if you want to install a reverse osmosis machine, have utterly nutrient depleted water, which is unhealthy and expensive. But what is technology that you need for clean drinking water? And when we went on the net and we looked, something that the WHO supports, Soumya, is folding a cotton sari, a well-washed, clean cotton sari 4 times, and you filter water through that, and you have clean drinking water. That's the kind of technology that has to be promoted for clean drinking water. Now, of course, I'm not suggesting that you use this for Ganga water in Kanpur, where the entire tanneries of the universe are putting in their effluents, but but you can use it where the burden on the water is not dreadful. I mean, in most areas, say in the mountain states, you do have some burden in your springs and natural sources of water, and the piped water is quite grotesque when you ever get it. So this 4 times cotton sari is a beautiful technology that works to give clean drinking water at this much cost to communities, and we promoted it. I mean, how much does a cotton sari cost? So $200, $300, you've got an access to clean drinking water. For me, that is a successful technology. As an integral part of nutrition, which nobody in this room needs to be told. On the question of what kind of foods we access, there is, of course, you flag the question that we're accessing all the refined and disgusting food. The runaway hit is what? Can anybody take a guess? The runaway hit of processed foods in all nutritionally challenged areas is Maggi noodle. Maggi noodle is like a rash upon the face of almost all mountain areas. And it's very easy to understand why. And when we try to understand why, that is what we have to keep in mind when you're trying to look for a technology. It is easy to cook. Because it doesn't take time. So it does not demand fuel wood, which the woman has to trudge to the forest, deforest the trees, schlep the wood back to light it, and cook rice and dal. Is she nuts? No. She cooks Maggi. We did a food study and found that in something like 20% of the households, Maggi was being eaten every day. Every day. And very often as a vegetable. So if there was roti left over from one meal, the Maggi would be used as a vegetable to eat the roti with. Now the reasons are the schlep for firewood, the time that has been raised over and over again, the time that the woman doesn't have to cook. So when we try and introduce a better food, we need to keep this in mind. We need to, I think the approach of hang the millet roti, let them eat the kurkure, might be the approach that you need to take in innovative ways when you're trying to address the question of what should be easy to cook millet-based foods. And I think that can be done as we've seen. Now, in our Poshan Vatikas, I mean, the nutrition gardens, which so many people are doing, and which is, of course, something that has to be done. It has to be done really as a national program, because that's one way of getting micronutrients into your diet at a reasonable cost, at an affordable cost in terms of price and time. And getting wild vegetables, what we like to call as underutilized, but getting wild vegetables and the kind of stuff that communities used to eat but are too shy to eat anymore, because they think it's backward, it's an indication of poverty. I call this the nano blister. You know what happened to the nano car? That lovely nano car that all of us should have been driving got killed because of a very bad ad program that projected it as the poor man's car. Now, I don't want to be called poor. I want to be called the person who drives the Mercedes-Benz or the BMW. So don't tell me nano is a car for the poor. I won't touch it. So don't call this as food for the poor. They won't touch it either. And I think that if you revive the tradition of foraging, which means picking wild vegetables and make it attractive, and we've tried that with younger people, and we've also tried Dr. Iyer's pet program. Dr. Iyer, are you hearing? Of schools. Here, hello, me. Nutrition gardens, Poshan Vatikas in schools. The kids have a blast. They get themselves really dirty and they enjoy themselves. They grow the vegetables, whether anybody eats it or not, I don't know, but they eat it while it's still growing. But they get used to the concept of fresh vegetables being something fun to do. So Poshan Vatikas in schools are a great idea and can be promoted, and I think that's another technology that can be very, very easily implemented. And the thing to do is to make recipes. If there's one thing we've learned from last night's dinner, is that you can make all of these marginal alternative foods delicious. If you don't make it delicious, as one chef told me, nutrition doesn't sell.
Thank you, Suman. And now I call upon Dr. Madhusudan Rao, who is the head nutrition at the Tata Trusts, to make his intervention.
Good afternoon, everyone. At the outset, I want to thank Swaminathan Foundation for giving me this opportunity to be present here. Respected Swaminathan sir, Chair, delegates, ladies and gentlemen. Being the last speaker of the session, I don't want to stand between you and the lunch. I'll complete my presentation in 5 minutes. I don't have much. I just wanted to just show within a couple of slides, I'll show what Tata Trust is and what kind of programs we are doing in this particular area of Nutri and Agri field. As you can see, this is the evolution of the Tata Trust over a period of time. It's almost now 125 years. And then the institutions what Tata Trust has built over a period of years. As you can see, IISc, TIFR, and the latest one being Tata Center for Development in Nutrition, Cancer Grid. And we work in the 7 thematic areas, healthcare and nutrition being part of it, then energy and climate change, rural upliftment, urban poverty alleviation, water and sanitation. Various thematic areas we are involved by way of giving individual grants to some organizations or even doing some direct implementation wherever possible. As you can see, though India's economy has grown, the per capita income has grown, but nutrition, demand for nutrition or the health of nutritious children is declining. I mean, it's not growing as per the per capita income. So that means people won't invest in the food, healthy food. And healthcare and rural upliftment, this is the portfolio. Like I'm going to cover a couple of slides in this, wherein we are working in various states on some pilot basis or through some NGOs. It's said that it takes a bio village and a family to raise a child. I'm just going to cover some farming system approach for nutrition. And the index of success, as it said, it works if young children are growing and healthy. So that's the index of the success which one should look for. As you can see from this graph, like by the time of the children are in the coming to Anganwadi, they are already wasted and stunted. And that continues, but rather doesn't decrease, but it still continues to be there even though they come to Anganwadi centers. And that's the one which we are advocating, like adopting Anganwadis and doing a lot of activities over there and promoting. Now I'll just show you one THR what we are going to do through SJRI. So as it is said that less than 3-year child, it's fed at home. So that's where faltering has occurred, and it's very difficult to gain back the faltering what has occurred. Then take-home rations from the ICDS, that's the important portion where if it can be improved, I think the child's health will improve. And the innovation sustain, as it is said, that investing in the existing self-help groups, that would be the a good proposition because it's already exists, and if we can invest in them and encourage them, that would give a better future for children. And one thing what I wanted to highlight here in this is like, though the money generated does not always go into better nutrition, technology is not just engineering, but it should be a social engineering is required. This is the one which I was talking, like take-home ration. It's already there for the ages in our system, but a lot of attention is required and research or attend is required on this particular part. And then Tata Trust, with the help of SGRI, we are engaging multi-stakeholders, right from government to private and doctors and everywhere in Karnataka, and do this study and propose to the government on the policy change. I was just coming across this technology which they say in site I saw that solar dryer is being used for preserving vegetables. And we have an arm called Social Alpha, wherein these innovation activities are encouraged, and a lot of startups are supported through this. And the objective is to empower small and marginal farmers towards increasing productivity and profitability. And I'm just running through a couple of our programs. Like one, we have Tata Dairy Mission. We have an arm called Dhani, through which we have, as earlier speaker pointed out, like without integrating livelihood and livestock and then agriculture, you can't have a complete growth. So this is one of the activities which we do, and it has really helped some like as you can see, like various activities, technological activities, what we do through them is like organizing infertility management camps, setting up quality testing centers for the milk. Then, as you can see, one of the beneficiaries, she says, who was selling about 50 to 20 liters of milk, now she's able to do about 40 to 45. Then this RGR, what we have is Sir Ratan Tata Trust and Navaji Tata Trust have launched this in program in 2002, and it still continues doing the work. And one more program what we have is Lakpati Kisans, that multiple cropping, as you already a lot of speakers have spoken about it. So this we are trying to pilot in a way and show that it's possible and increase the income of agriculture laborer at least by 1 lakh per annum. So that's the program which is really running successfully in Jamshedpur, Jharkhand. Thank you.
Thank you very much, Ms. Madhusudan. So I think we'll take just 5 minutes and we'll collect a few questions and then ask the panelists to respond. Yes, please, you can start over there at the back and then we'll come to you in front.
We have to bring together all the government agencies, non-governmental agencies, corporates and nutritional specialists and technologists to evolve a system by which we produce good quality agricultural products for controlled price without any wastage of agricultural products. If we find fault with the existing systems, I think it is the right time to submit the alternative system for the society to solve various kinds of problems. Of course, the technology is there to apply at different levels. It is used in all levels, starting from preparing the infrastructure for agricultural products and then preserving it, processing it, so many levels. We apply the technology, but ultimately we are yet to evolve a system by which we could reach our goal. As our MS Swaminathan dreamed, we are yet to reach the ideal, our goal. So we have to come out with a concrete proposal to evolve better system.
Thank you. Thank you, sir.
My name is Eva Badola. I'm working in association with MSSRF as SBI Youth for India Fellowship. fellow. So my question goes to Dr. Suman. Ma'am, I belong from Uttarakhand, and I can definitely say that the traditional grains are fading at quite a speed. It's pacing, and simultaneously the associated traditional knowledge of farming practices are also fading. And ma'am, like you mentioned about the geographical roughness and isolation associated with the Himalayan geography, that is also a difficult challenge. So like you mentioned about the value addition, the importance of value addition, and how the technological advancement can play a key role. So ma'am, as far my experiences goes, a lot of women have reported they are involved in the household and cottage industries. But the problem is the procurement of raw material. They are not getting enough raw material to procure those traditional grains. So the question goes that apart from technological advancement, do we need to look on the propagation of farming practices also? That has to be emphasized.
Thank you. Dr. Nafis Mia?
Shrivali, I think you're right in terms of the need for taking a systems approach. Absolutely right. And the number that you gave on food expenditure in rural areas is being repeated across South Asia. We've got evidence, similar figures in Bangladesh as well, which means that we're on a food system transition, and we have lots of evidence of where that is going. We have to look at other developing countries that are further down, and it is towards poorer and poorer diets. The fact of the matter is, this will continue. The trend will continue. Companies that sell Maggi will be more and more effective in outreach. And the question is, given that household expenditure, food expenditure is going to go more and more on processed foods, one of the things that's missing here is food processors and how we work with them in ensuring that the diets are healthier than what's currently available. So the question is, to what extent you and Dr. Sale are working with the private food sector to say, how can we improve the quality of the products that you are selling in rural areas?
Madam, I covered the whole forenoon session in 1 or 2 minutes. The message is, 2 questions are often asked. Technology and its adoption is resource neutral? Is technology and its adoption is size neutral? If you answer these 2 questions, then we can come to the answer of leveraging agriculture, land holding size, nutrition, and healthcare. Now, when I say technology is not size neutral, the answer is, Dr. Hegde very well explained, where the land ownership will remain in the years to come 80% marginal and smallholder, because that is the hereditary right. But the technological adoption can come as a solution by aggregation. In terms of operation, there will be medium-sized holdings, there will be large-sized holdings. So input mobilization, credit, processing will all be in the level of medium-sized holding and large-sized holding, like in the corporate sector. And Dr. Suman said very well with examples that technology, when it comes to agricultural land holdings, is not also resource neutral. Thank you.
Thank you. I'm going to ask each of the panelists to try and respond in a couple of minutes.
Thank you. Nafis, I'll just respond on your question around private sector and improving the quality of diets. I agree that it is extremely crucial to bring in food processors, but also large industry conglomerates, whether it is the manufacturers of Kurkures or Maggies, but they have to be in the conversation when we are talking about it. Because not only is the requirement of bringing in some of these new product line into their marketing chain, but also how we can learn from their delivery channels. I think that is very, very critical. If you go even in the remote areas, you can see a small package of Maggi, or you can see those small packages of Kurkure. They are not the large size packages that you get in other metropolitan cities. So how can we exploit some of those delivery channels as well? And to your point around healthy diets, one of the things that we've seen, and this is an example from Maharashtra, is that one of the company, they started on experimenting on solar dryers for drying of vegetables at household level. Now they have actually partnered with some of the private sector and are marketing their product line on Amazon under the brand name of Desi Videsi, which is basically taking some of the vegetables which was otherwise going waste at the farm level and converting them to dried or dehydrated food products that have larger shelf life. So I think some of those innovations in technology coupled with a change in behavior but also a delivery mechanism is very critical, because as more and more we are looking at ease of cooking, less use of time, and with even less time available at the women level for for the care work or for the cooking work, it is important to consider all of these when you're designing a channel.
To address you very quickly, there is a crunch on the availability of millets. I'm not so sure we need to teach women how to do it. And millets, if you're a party girl, millets are very typically a woman's crop. The men have never cultivated millets. It's just not interesting enough for them. Women still know how to cultivate it. We hold farmer field schools just to sort of upgrade more troubleshooting and problem solving. So I don't think you need to do a whole technology education, but you might need to do upgradation, troubleshooting messages. On what do you do with the private sector, I think you need to do a lot, provided they're willing to do it with you. My only fear in this is we've been trying to organize the samitis into becoming self-reliant producers themselves and to posit them as competitors to Nestle or whichever other agency there is. Either you need to call on their sense of ethics and morality, which I'm not so sure about, or we need to find a model. I can't say that I have any answers. It is something just to say that we would like women's groups, they can produce quality stuff. They can produce stuff in a decentralized way and market it in a decentralized way so that Uttarakhand women are selling local, fresh Uttarakhandi products. So also other states. It's, as a concept, it's certainly worth exploring. I'm not sure how.
Yeah, I think private sector, as you rightly said, until and unless that comes into picture, it's very difficult for us to drive this nutrition projects, But one thing I should say, sir, like demand should be there. Like once if demand is there, then there are people to make, Nowadays, if you can see, I'll just tell you that with Mars collaboration of USA, we have developed a product called Gomo, and it's a snack, chickpea snack with nutrients in it, and trying to sell more of it in the unconventional channels in the rural market, and replace the ones which are there like Lays and aloo chips and those kind of things. But the difficulty here is like matching the price, that the price of which is available in the market there is 5 rupees, whereas this product what we were selling, what we are promoting is at 10 rupees. But though I think it will take little time for people to realize to know the importance of the nutrients. So it should be a demand driven. That's what I feel. And one more thing is FSSAI has recently had this eating right movement, So that's one of the awareness campaign which need to do more and more so that people are aware and demand for the nutritious food. So that's what I feel that then definitely private players cannot be sitting behind and watching. They'll definitely rush when there is a market. So that's what I feel. Thank you.
Thank you very much. So I think we need interventions at all levels, at the policy level, because certainly I think things like taxing unhealthy foods, which some countries have tried, could also be used. If you have a sugar or salt or fat content above a certain level, heavily tax that product so that at least, it becomes unaffordable for many people. So at that policy level, I think one can do the FSSAI regulations and guidelines, and that again is more of voluntary at the moment. It's not a law, mandatory. So we have to encourage private sector to also make voluntary changes in what they are marketing. And then ultimately, I think health literacy and the demand for healthier foods is the only thing that's going to drive change from industry. So I think there needs to be a community demand for affordable but healthy products. And that's where I think awareness and literacy around health and nutrition plays a big role. So I want to thank all the speakers this morning. We've had a long but I think a very rich and interesting discussion, lots of ideas and take-home thoughts from all the speakers. So once again, thank you very much. I think it's time for lunch and you'll make an announcement. Thank you.
So on behalf of the organizer, let me thank the chair and co-chair and Dr. Peter for delivering the keynote address, and all the 6 panelists for their wonderful intervention and remarks and inputs, and also for the wonderful audience for making such innovative questions and receiving the response. This will be very useful for MSSRF further journey from now onwards. Thank you very much, one and all.